Go ahead, Jessica.
Good morning. Today is Thursday, May 20th, 2021. Commissioners Court is meeting in special open session. Today we are joined by ASL interpreters Dario Garcia and James Garcia. Would you please rise and join us for the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Item number 3 is public comment. At this time, we do not have anybody signed up to speak for public comment. Unless, Judge, would you like to make some opening remarks before we begin?
Please, thank you. Thank you. So welcome everyone on behalf of myself and the commissioners. We welcome you to the special session. As you know, on a monthly basis, we have a special session where we try to get in a little deeper into the topics, and so very appreciative of our audience being here today. Commissioner Leon, I will be stepping out. I've got the MCAs doing an incredible task force for the next 2 weeks, and I'll be opening the task force for Emma Schwartz. And if you do me the honor of taking over at 9:30, and I'm sure I should get back hopefully no more than half an hour. So thank you as always for helping out. And
not a problem. I'm sure we'll be finished by 9:30, Judge.
oh, okay. Yes. Yeah, so when I get back, please wrap everything up and give me a summary. Also, yesterday, just extremely excited about the Commissioner Stout and myself did at Escarate, we had Progress 321, which is a great organization that tries to keep our young people here in El Paso by providing, development and excitement about El Paso, and also those that have left, hoping that they return, but also those that have left that have interest in El Paso, whether from donation interest or volunteering on boards that they can serve from a distance. So I think Commissioner Stout and myself, I think we have a lot of more ambassadors about Escarate and all the incredible, new things that are developing, the projections. They went over the master plan with Mr. Carrillo, go over that master plan with them. So pretty exciting opportunity to get them engaged, and had a little peek at the Healing Garden. Tremendous, great feedback about where we're at and what's happening with the Healing Garden in the 30-day series prior to that. So once again, I welcome all of you. I know we're going to have a very productive meeting today, and I hope you stay tuned and that you follow our sessions throughout the day. Thank you very much. Jessica?
Item number 4 from the regular agenda. Receive a presentation and discuss and take appropriate action on the County of El Paso Health and Dental Plan Design and Premiums for Plan Year 2022, Employee Benefits, Liability Insurance, and Employee Supplemental Pay and Leave.
Good morning, Judge, Commissioners. Melissa Carrillo with Human Resources. Each year in May, the Human Resources Department presents various pieces of information to you all regarding our benefits, supplemental pay, and liability insurance in order to really inform you all about where we're at today and seek some guidance as we approach our next budget. That's something we do every May, and it's standard. This year, based on the current situation, we are amending our plan to also provide the court with an annual report of our medical plan performance from the actual clinicians from Aetna who have analyzed our member claims throughout the year. I think this will give some great insight as to what's been happening and what's been occurring with our claims regarding our medical insurance plan. We would then like our HR staff to address our plan, design, programs, and premium recommendations for 2022 with the intent of both informing the court, but also, again, receiving that guidance and direction so that we can sufficiently prepare for FY22 or for calendar year 2022. And lastly, we'd like to briefly discuss some of the other benefits and pay plans that were given in 2020, just to provide the court with an update on utilization and how those performed. To get us started, I'm going to turn it over to Sam Trujillo, our Senior Deputy HR Officer, so that he can discuss our medical plan with you all. Sam?
Thank you, Melissa. Good morning, Judge, Commissioners. Sam Trujillo, with Senior Deputy with the Human Resources Department. Today, we have actually for the agenda report, we have provided the court with a lot of information in advance. But today, what we'd like to do is just highlight some of the important key areas and not go over every single slide unless the court has a question on a particular slide or area. So as you know, the county currently sponsors an employee medical plan, which is self-insured through county contributions and employee premiums. Throughout the year, plans, programs, and strategies are developed in an effort to help control medical costs. We do this through communication and coordination with the county's risk pool board, medical consultants, the county attorney's office, and third-party administrators, and of course our plan members. Today, like Melissa said, we have asked our third-party administrators, Aetna, to present our medical plan's annual report for 2020 and provide information specific to the high-cost claims that we experienced in April, and I discussed with the court on last week's presentation, which led to the infusion that was recently approved by the Commissioners Court. So for this part of the report, I would like to turn this presentation over to Michael Garza, who is Aetna's account director, and let him introduce his team and go over the data. Michael?
Good morning, Judge, Commissioners. Thank you guys for allowing us this opportunity to meet with you this morning. I have invited two of my peers, or actually three. We've got Emily Nolte from our pharmacy area. Emily is a strategic pharmacy account executive. And we've also got Gabriela Zuniga, who is an account manager and who is local there in El Paso. And we've got Norma Thompson, who is a registered nurse and is a clinical client consultant. And Norma will be pretty much delivering the information over the clinical aspects of the performance for the county in year 2020. So to get us started, we're going to start out with the pharmacy presentation first, have Emily go through that, and then we will transition into the medical plan and then the clinical data. So I'm assuming someone will pull up the pharmacy deck and we'll have Emily walk us through the slides.
Perfect. Thank you. Good morning, everyone. So we want to start off and say that the plan is doing very well for the county, and we appreciate the time to come in and discuss and go over what we're seeing and forecasting trends for the future as well. Now, we see along in the top in our cost section that the net cost PMPM increased roughly 11.4% to $113.25 per member per month. While that increase was impactful to your net trend, that is still significantly lower than what we are seeing in your same peer group and also in the aggregate Aetna CVS book of business. So the plan is still continuing to perform very well, and we have several programs that you've already implemented that are working to keep these costs down. We can see that these programs are working through that member cost share has remained stagnant from year over year as well. Into the drug mix section, we do see the generic dispensing rate decreased just a slight amount. However, we saw a significant increase in that single source brands. This is primarily driven due to the increase in the specialty utilization where there are not generics available. This is not uncommon, and we do, of course, understand that specialty brands are new and coming forth all the time. Another great indicator of plan design is in that utilization section. That retail 90 had a significant increase in year-over-year performance. We do see the total prescriptions decreased, but of course with that 90-day prescription, members were filling one prescription instead of three per equal day supply. So we do see that that is to be expected as well within that utilization of those prescriptions. And we'll talk a little bit more about specialty in a few moments as well. But specialty, what was driving the most significant trend within your plan? We see there was a 24% increase in that total net cost. And while, again, the specialty percent total net cost box in that area below shows that increase of 12%, having only 40% of all of your plan dollars spent in the specialty section is very great. We're seeing on average 50 to even 55% of all pharmacy dollars spent in the specialty space. So again, the county has done significant strides to keep and manage their programs. We can move on to the next one. This is a great slide that demonstrates how the different views of pharmacy spend break out. At the top of the pyramid, we do have the complex members, and these members are the greater of 50% chance likelihood of having more than a $5,000 in medical and pharmacy costs next year. We see that they are 10% of your population is spending 78% of all pharmacy spend. They are costing the most, average cost per member at $906. They are 100% of our specialty spend, and they are our older population as well at 52. These members are going to the pharmacy on average 25 visits per year, managing on average 7+ drug therapies. These are our high-cost claimants typically, and they are our high risk. In the middle section, we have our chronic members, and these members are between 15 and 50% of having that same $5,000 spend in the next year. These members are on more of their maintenance medications with their chronic conditions, and they're making on average 9 pharmacy visits per year as well. And then lower in this bottom section in the episodic, these account for 66% of your members, and they contribute 6% of the total spend. They are your lowest average cost per member at $10.90. They also have a higher generic dispensing rate at 88% GDR, which means that they are taking generic medications as they are not in those higher disease states. 24% of those 66% members have no prescriptions at all either. And these are well-managed, well-controlled members who are taking 2 to 4 maintenance therapies, solutions, and top actions that we would recommend for next year. We can pop ahead to the next one. Perfect, thank you. So as mentioned earlier, the County of El Paso has several programs already in place that are driving significant savings as well as control. We do have 2 programs that we would recommend, and one of them is new to Aetna with our integration to CVS for 2021. This is called Drug Savings Review, and this is a provider-directed intervention for any alternatives that we could identify. This may be a discontinuation of a product that is not recommended for more than a certain length of time. It could be a combination drug instead of 2 separate drugs, or it could be an alternative dosing in terms of a multi-day, and we could get that to a long-acting. This is 0 member impact as we communicate 100% with the provider on alternatives based on the formulary, and the provider will work with the member to determine if that would be an appropriate course of action. There is a 30-cent per member per month fee. However, there is a 3-to-1 guaranteed ROI on that. Based on our 2020 claims data, we projected an approximate $172,000 in future savings. And of course, that number will continue to change as more therapies do become available. And then finally, one of our final recommendations would be Maintenance Choice Network. we saw that significant increase in that 90-day prescriptions at retail. And that lets us know that members are very happy to get that mail benefit in that retail location. Maintenance Choice does limit that 90 days to CVS retails. However, in exchange for that, the plan also gets steeper discounts for those prescriptions. And one thing, too, I just wanted to point out is that True Accumulation was added for 2021, and that will also help to control any of our additional specialty spend that maybe members are currently utilizing a copay assistance card for. So all in all, the plan is doing very well from a pharmacy perspective, and we expect to continue to help monitor and control your pharmacy spend.
Hey, Emily.
Yes.
Can you hear me? I just want to make a comment for the audience. As you'll see, all of the purple bubbles or the purple dots are programs that are currently in place. And we work in collaboration with the HR team and with Hub throughout the year to bring new programs or innovative ideas or strategies to the county in hope of getting these implemented in order to save money and improve the member experience. And the True Accumulator copay optimization that's noted there on the slide was implemented in 2021, but it was off cycle, meaning that it was added somewhere during the year, not necessarily on the beginning, like a 1/1 effective date. So I just want to emphasize that, a lot of the programs that we roll out or that are new, the latest and greatest, we bring them, during the year and sometimes are able to implement those off cycle in order to make an impact. So just wanted to share that little bit of information.
Thank you, Michael.
Mm-hmm. Are there any questions from the audience for Emily? Okay, I think we'll go to the medical deck now. And if you can pull up slide 3, that would be great. I think one more, there you go. So again, good morning, Judge and Commissioners. Thank you for allowing us time to talk about the County of El Paso's 2020 year-end performance. When we typically meet with HR, we review and compare incurred claim data from January through December of 2019 versus January through December of 2020. Again, this is incurred claims within that period with a 2-month lag, meaning that they were incurred within that 12 months but paid through February of the following year. The executive summary is really designed to capture the highlights along with ideas and our recommendations that we've shared with the county for where we think we can make an impact. As we all know, and you guys are very familiar, 2020 was a time like no other, in that a virus, COVID-19, brought about some incredible challenges and opportunities to the healthcare system. Millions of people around the country, including members of the county, were forced to delay necessary non-critical treatments, while at the same time, physicians were granted flexibility and innovation with treating patients remotely through telemedicine. And these services range from checkups all the way to addiction treatment. Many clients during this pandemic experienced a flat or negative trend, and this holds true for the county. As you can see from the key insights column, the county's total medical spend decreased by negative 1.8 from 16.1 million to approximately 15.6. The decrease is mostly relative or attributed to a decrease in medical utilization as well as an increase in the number of high-cost claimants. That's what really was driving the trend. The per member per month cost and utilization were down, specific to outpatient care, primary care visits, specialist visits, and lab. However, we did see an increase in the cost for emergency room, inpatient, radiology, and medical pharmacy. ER was primarily driven by the freestanding emergency rooms that are there or located in El Paso. One of those, and I'll show you in a few minutes, is Sun City. At one point in time, these freestanding ERs were popping up all over the country, and you could pretty much find one on any corner in any major city. Several of them have shut down in El Paso, I believe, as a result of some of the legislative restrictions that have been placed on them. However, there are a few that are remaining in El Paso. Sun City is probably the predominant player. I believe when I was traveling before the pandemic hit, I would see banners in the airport when I would fly into El Paso, you know, promoting their services and their locations. The good news about that freestanding emergency room is that they are contracted with Aetna through what we call a National Advantage program. The discount that we were able to achieve with them is not as deep or not as strong as one that would be based on a hospital-based emergency room, but nonetheless, we were able to negotiate a discount. These type of facilities have never been players with insurance carriers. Their rates are extremely high, and so most of them are not participating at all. So, you know, the point that I'm trying to make is that if you're going to have any of your population utilize any of the freestanding emergency rooms, which we really do not want to recommend or promote, Sun City would be the freestanding ER of choice, since we do have a negotiated rate with them, and it's less than those that are not contracted at all. We mentioned above about the number of high-cost claimants that increased. However, the cost per average claim on those decreased slightly. This is a little bit different than in 2019. In 2019, you had fewer high-cost claimants, but their costs were much higher. The claim per high-cost claimant was at a higher rate. The next few slides are going to back up or substantiate some of this information that I've shared, and we'll come back to the recommendations column. So if you can flip to the next slide, that would be great. So this is our network. I can't see the header. It's the network management slide. So if you look under the claims paid line, you'll see that it went from 92.4 to 92.1. So there was a slight decrease in the in-network paid amount, and that's mostly, you know, due to the fact that there was some freestanding ERs that were part of that configuration. If you look down below, you'll see outpatient facility claims paid under out-of-network, and you'll see a quite hefty increase. The numbers are not as large. It's 1.4 thousand to 32.6 thousand, and equates to over a 2,000% increase. So when we were doing our research on this, I'm always looking at why a member would choose to go out of network in El Paso when there are many facilities that are available. When we researched this, we did find that this utilization of an outpatient facility that was out of network and out of state was based on the decision of the member. There were plenty of outpatient facilities that were available to this member in El Paso. However, due to the fact that the benefit design includes an out-of-network tier and allows for the ability for them to go out-of-network, they made the decision to go out-of-network even though their member cost share was going to be higher. So I just wanted to share that with you in the event that there were questions around that line item. If you look to the right under discount savings, you'll see the total amount of discount savings equated to about 67.1% for a total of about $31.6 million. It's a slight decrease from 2019, and that's again because your total medical paid decreased. So that's why you have a slight decrease in the total savings. Can you flip to the next slide, please? So here's a snapshot of your out-of-network utilization. You'll see prior and current. Both are sitting at 1.2 million, and it reflects a 0.3 change. This is because of the rounding up of the numbers. They're pretty parallel or constant. If you look on the left, you're going to see the top 10 out-of-network procedures by claim dollars, and on the right, the top 10 out-of-network providers by claim dollars. Here's where we see that freestanding emergency room on the right under Sun City at 240,000, and then one right below it for 130,000. The point that I'd like to add or add some additional commentary on this slide is that during the pandemic, when people were able to get tested, testing was only available in emergency rooms. And I believe that a lot of this utilization was driven, by that fact, as well as people having a little bit of hesitation or fear of going to those emergency rooms that were linked or connected to a hospital. I think there was a fear of the social distancing and not wanting to expose themselves. to a larger group of people or people that were coming in and out of the hospital. So for that reason, we did see an uptick in the freestanding emergency room utilization. But again, you know, if we're going to have any members utilize a freestanding ER, we would want them to utilize Sun City, as they are the provider or the freestanding that we do have a contract with. You'll see down below, you've got Pure Soul Emergency Medical Associates, Odin. A lot of those are freestanding and are not part of our contracted network. If you go to the next slide, this is just for an illustrative snapshot to provide you with some insight on how we kind of come up with our analysis. So if you look on the left side under key statistics with high cost claimants, and you look at emergency room, for example, you'll see that the PMPM, which is an acronym for per member per month, increased by $42, or it was set at $42, which increased by 6.1 if you see the per member per month change. If you look to the two columns on the right of that, you can kind of identify where that change is attributed to, or what it's attributed to. Utilization dropped negative 6.9. However, the unit cost increased 13.9, and that's because the freestanding emergency rooms are much higher than the hospital-based emergency rooms. So that kind of gives you some insight. When you see anywhere on the PMPM change column where it's a positive number, you can determine by looking at the two columns on the right what's driving that positive number. Is it an increase in services, or is it attributed to a unit cost change? So I think at this point, we're going to move into the clinical segment of the presentation, where Norma Thompson, who's an RN and has been working with me and the county, I think for the past 6 years, you know, we can really provide a drill down on what's going on with the population from a clinical perspective. And I think it'll be extremely insightful. So with that, I will turn this over to Norma. And if you can flip, to the next slide, that'd be great.
Thank you, Michael. Good morning, everyone. It's a pleasure to meet with you today. And I'm going to review the population health slide. Can't see the top of the header, but that's what this is. This population health slide highlights the 6 key chronic condition values which drive utilization, medical spend, including high-cost claimants. Now, we see an increase in the values and that are above book of business, except depression. Hypertension, hyperlipidemia, gastritis, and low back pain, those are conditions associated with metabolic syndrome, and diabetes is the end result for metabolic syndrome. These 4 conditions are also closely tied to obesity and depression, and can also be a leading cause of back pain. 50% of county members with a musculoskeletal diagnosis also have diagnosis of obesity and depression. And members that have diabetes and hypertension diagnosis, if those are not well managed, they can lead to renal failure, dialysis, congestive heart failure, and stroke. But I do have good news. All these conditions are impactable, and they can be influenced through behavior change with member engagement in the Aetna Care Management Program, participation in the 8-week Able To program that provides support for members that have chronic conditions and a diagnosis of depression, stress, or anxiety. And there were 2 graduates in 2020 Able To program. We saw a decrease in preventive screenings and preventive visits due to facility closures during the pandemic that were unavailable to provide the elected screenings. And we saw this decrease across all customer reporting. You see that breast and cervical cancer screenings were above book of business, as were child and adult preventive visits. And we have sent the county member flyers to help promote screenings and preventive visits in 2021. At the top of the page, you will see the inpatient severity index score increased, and it's above book of business. Excuse me. While the member is inpatient, the hospital reviews the diagnoses, and when additional medical services are utilized, we see that severity code increase. And right below that, you'll see the retrospective risk score measures the illness burden of a population, and here it's with the member and the employee. Aetna reviews the diagnosis and procedure codes, and the scores are aggregated and averaged out for the groups. A score higher than 1% indicates a sicker population and current need for healthcare services. Now, the scores for both groups decreased from the prior. This was due to a decrease in medical services, elective surgeries, because of closure of facilities due to the pandemic. Okay. And if I don't go over some information on these slides, I'm doing a high-level overview. Please stop me and I'll be glad to answer your questions. The next slide, please. Okay, this slide highlights all the population health member conditions. This is for all the membership with the county. And you can see the number of claimants and prevalence for conditions. Now, like 2019 review, hyperlipidemia and hypertension remain the two top conditions with the highest values of all chronic conditions. The two graphs stratify the comorbidities associated with hyperlipidemia and hypertension among all member population. Comorbidities are when a member has multiple chronic conditions at the same time. And here we see obesity has a third highest number of claimants and prevalence among conditions associated both with hypertension and hyperlipidemia. The next slide, I'm going to be reviewing employees-only conditions. If you look at the chart at the bottom of the page, employees have a higher prevalence of hyperlipidemia and hypertension than all members. The two top graphs highlight the comorbidities associated with hyperlipidemia and hypertension, and again, obesity has the highest number of claimants for both conditions. There are solutions, though. You have programs now that can help members manage their conditions and comorbidities. The Aetna Care Management Program has condition education with registered nurses and registered dietitian that can help members with weight loss management. The Able to 8-week program treats depression, stress, anxiety associated with medical conditions. And you have an award-winning wellness program in place for your employees. So using a multifaceted programs approach, we can help support members to self-manage their conditions and increase a healthier population. Okay, the next slide. Now this is the Able to program utilization. This highlights the participation in 2019 and 20, and we see there were 2 graduates that completed the 8-week program in both years. Now, we have provided the county with updated flyers that reviews the program details and will help to promote the program, and we want to increase member participation in this program. Okay, the next slide, please. Okay, this is diagnostic categories. And the high-cost claimant threshold is $100,000. You can't see it on the top of the slide, but that is what it is we'll be talking about. Now we see that on this chart, the blue is the high-cost claimant values, the non-high-cost claimant is like the green. So cancer, newborn, and neurological spend was driven by high-cost claimants. And we do see there was a 2.3% decrease in total spend for cancer, and there were 6 high-cost claimants with a cancer diagnosis. The infectious disease, we can see that it increased substantially, and I'm looking at the bottom left, increased from 1.9% to 8.8%, and that was due primarily for COVID and sepsis associated with COVID. And we can see that cancer had 10.4% of total spend. We know cancer is expensive to treat, and the earlier disease is diagnosed, the sooner treatment can begin for successful outcomes. We want you to continue to promote the preventive cancer screenings, and we have a cancer support center located on the Aetna members website. This site offers education on prevention, diagnosis, and tools for members and caregivers during and after their cancer treatments. We also have the Able to program and the Nurse Care Management Program that are also available to provide support for members with cancer. Okay, the next slide, please. And this is the high-cost claimants slide. And here we see there was an increase in the number of high-cost claimants per 1,000 and the percent of total paid. There was a decrease of 25% in the average paid per high-cost claimant, and that was slightly below book of business. We had mentioned the prior year had large single high-cost claimants, and in 2020, we did have more high-cost claimants, but with a lower average claims cost. The number of high-cost claimants and total pay for the top 5 diagnostic categories as oncologic disorders with 23% of total paid. Oncologic disorders has 6 high-cost claimants, and that impacted the medical specialty RX with 7.1% of total high-cost claimant spend for chemotherapy. And later in the presentation, I'll be reviewing the medical specialty RX information. Okay, the next slide. This is the slide on the Aetna InTouch Care case management program that provides condition education and case management with a single nurse. The nurse also provides support for the entire family. And we had 81 members engaged with an RN case manager and 1,655 engaged in online digital education. Now, the Aetna InTouch Care program transitioned in 2021 to a new single nurse care management program, and it's called Aetna One Choice. The RN will continue to provide condition education and case management and continue as nurse for the entire family. But we do have new features in Aetna One Choice program, including case managers will now send text reminders for their appointments with the member. Members can make self-appointments and self-scheduling for group coaching that informs and educates members to encourage behavior change, and they can utilize the group coaching through their computer, tablet, or phone. The group coaching topics include chronic conditions, medication non-adherence, and ER risk and usage. Pharmacists, registered nurses, and social workers will lead the coaching. And we have already sent the member flyer to help promote Aetna One Choice program with the membership and to increase the engagement levels. There was good news on the 2020 care management PEPM savings was $68.82. Okay, the next slide, please. Okay. This is our maternity slide, and we see there were 44 deliveries. That was a decrease from the prior. A C-section rate of 50% was above the CDC rate of 32%. We do additional drill down to see actually why it was so high compared to the CDC rate. But there were 23 members who had C-sections. 14 of those 23 had had previous C-sections. So essentially, there were just 9 members that had first-time C-sections. We had 2 members that were inpatient for pregnancy complications and 4 babies that were in the NICU. The good news for the program, our maternity program, there were 22 moms enrolled in the program, and that value is above book of business. And we had high-risk deliveries were also below book of business, and 19 moms completed the postpartum depression screenings. And to promote the maternity program, we sent a maternity program flyer that promotes completing the pregnancy survey before 16 weeks of pregnancy, and members receive a gift from Aetna. It's a wedge pillow as a reward. At high risk, and members who complete a postpartum assessment with their RN case manager also receive another gift, a book on baby's first year as a reward. We also have a maternity support center in the member website, and that provides education and support prior and during pregnancy, after delivery, and for the baby's first year. And as I mentioned before, we've already sent the flyers that can promote the maternity program and the maternity support center with the membership. Our next slide, okay, this is on emergency room use. And we saw a 7% decrease in ER visits per 1,000. Average pay per visit increased 14%, and both values were above book of business. There were 114 non-urgent ER visits per 1,000, and that decreased 2.6% from prior. And to the right side of the slide, you'll see that 23 members had more than 4 ER visits, which was above book of business. To help decrease non-urgent ER visits, we have the Informed Healthline program that is staffed by 24/7 RNs who are available to answer questions about the appropriate site of care from members that call in. The case management RNs contact members who have more than 3 ER visits in a 6-month period. The RNs assist members to select a PCP if they don't have one. They review the medical services they utilize in ER and assist with locating a medical provider that can provide those services rather than utilizing ER. And we also sent a new flyer that was recently developed that has a side-by-side comparison to help members select the appropriate site of care. This flyer provides the medical services that are provided, the access, availability, pricing, and average wait times at the PCP, non-emergency clinics, urgent care clinics, and ER. And at the bottom of the slide, you'll look at the top 5 facilities that were utilized for ER visits. And we see that Sun City had 8.6% of the ER visits. Okay, the next slide. This is also a continuation of ER, but this is on alternate sites of care. And we see that there was an increase. I've highlighted here with blocks a total visit at non-urgent clinic sites and the less utilization at urgent care clinics. The average pay per visit ranges from $28 for the non-urgent clinics, and there's a higher price for urgent care. And it seems that with there was a decrease, at least, that members did not appear to utilize urgent care clinics as much as they had the prior year. There was a total of 4,008 telemedicine visits, and that's a substantial increase. So overall, it looks like the non-urgent clinics and telemedicine utilization was strong for your membership. Okay, our next slide is on behavioral health. And there is a change in the behavioral health high cost claimant threshold. It's now $100,000. It had been $25,000 in 2019. We see a decrease in spend and utilization for behavioral health services from the prior period, and there was no change in the percentage of members accessing services. We know that most physicians and counselors' offices were closed to see patients due to COVID, but members were able to utilize 863 behavioral health telemedicine provider visits. We see the paid amount for substance use disorders did increase, but that's below book of business. There were no high-cost claimants. And the graph to the right of the slide highlights a decrease in utilization and spend from the prior period for both inpatient and outpatient. Okay, the next slide is also associated with behavioral health. We see here the inpatient and the outpatient spend decrease from the prior period. At the bottom, you're going to see on the top 5 behavioral health conditions, the prevalence of depression and anxiety are the top 2 conditions. The 1.6 million total paid for depression includes all medical claims that a member accumulated in 2020. And the total paid per claimant with the condition is only for the depression claims. The graph to the right identifies dependents up to age 26, with 55% of total behavioral health paid by relationship. You see that employees had 37%, spouses had 9%.
Norma?
Yes.
This is Betsy. I just wanted to point out one of the things that we've heard in the community is just the impact of the pandemic and remote schooling on dependents. Would this be reflective of that?
You know, I have to say that with most of my customers, yes, I have seen an increase in dependent, behavioral health utilization. So I would have to say yes. And it's good that parents are seeking help and young adults are seeking help. That's what we want.
Agreed.
Thank you.
Okay, our next slide.
Recognition of time, how many, okay. think we're
I
almost
have
to
biometric screening. I'll do a very, very high level overview. We saw that screenings decreased from the prior period. And you can see I highlighted specific screenings and completed screenings from prior and current year. What I want y'all to take away from this is that members that had screening health issues that were identified, they were placed in a treatment plan, while members without screening because of their increased spend usually had an urgent medical event to diagnose and utilized more medical services to treat the disease. On the to the far right, you will see there are results of members with completed screenings from no risk to 3+ risk factors for a diagnosis of metabolic syndrome. Diagnosed members are in a physician-ordered treatment plan to help mitigate future health risk. Okay, the next slide is on medical pharmacy. That would be, yes, there we go. And this are medical pharmacy are medications infused with a needle. Site of care can be in an outpatient hospital facility, an ambulatory infusion center, a physician's office infusion center, or at home. Our site of care department reviewed where all County of El Paso members are receiving infusions and all are at the appropriate site of care. We see medical pharmacy as 7.6% of total medical paid. We see chemo and non-chemo PMPM spend increase from prior, and both values are below book of business. And we see of the top 5 category for specialty drugs have oncology with the highest percentage of total paid at 48%. Now, this last slide I have is on inpatient facility. We see that cardiothoracic surgery increased in the prior. Due to high-cost claimants, the CCU, ICU, and NICU PMPM increased from the prior. And we saw the average length of stay increase from prior, but the average cost per day decreased 20%.
Yeah,
This
I don't think we
concludes
switched
all
the
the slides
slide.
presented today. And if there are additional slides in the supplemental section for your information, your review. Thank you. Are there any questions? Thank you very much.
Thank you. Can we go back to slide 3 of the medical presentation, which is the executive summary? And before I get into the recommendations, I wanted to circle back to Mr. Trujillo's request that I shed some insight, I guess, on some high-cost claimants that were part of the claim wire requests in the month of April of 2021. So in April of 2021, the county received 2 wire requests to fund claims. I believe one was on 4/8 and the other was on 4/22. And the 2 wire requests, I guess, totaled approximately $1.7 million. What I want to share with you is that of that $1.7 million, there were 5 members that made up $800,000 of that. And I'm going to give you just a quick summary of those 5 members for informational purposes. One was a single live-born infant who was in respiratory distress. They ruled out sepsis. The pneumonia was resolved. They were discharged on home oxygen, and they were following up with pediatric pulmonologist and cardiologist for outpatient care. We reached out to the member several times through mailers for the maternity program, and there was no response from the parents on this particular baby. The second member had a fall, and an MRI revealed an osteomyelitis, inflammation of the thoracic spine. They were treated with IV antibiotics. The infection was resolved. The third member had a rheumatic aortic stenosis. It was a cardiac surgery where they needed to have an aortic valve replacement. They were discharged to rehab, no complications. We'll follow up with outpatient and cardiologist for PCP monitoring. The fourth patient or member was inpatient for COVID, and they were treated for sepsis. They were discharged home and have home health nursing services for wound care, but they were inpatient for approximately 23 days, and they were transferred to a long-term care acute facility, but they're still ventilator dependent. The fifth member was another newborn, NICU baby. The baby was born at 32 weeks of gestation. They were admitted into the NICU unit. They were inpatient for 39 days and weaned from oxygen. The member was identified as a high-risk pregnancy due to previous maternity program history. Our program made several outreach calls from the month of July through December with no response from the parents. The baby was born on 12/16/2020. So I just wanted to share that insight with you. We may want to brainstorm on ideas on, maybe increasing some kind of or incentivizing the maternity management program. I do believe the county is currently incentivizing it, but I've seen other plan sponsors that put a little bit more of an incentive, something similar to maybe even waiving the inpatient hospital copay for mothers when they go in for delivery. I think it's for the core plan, it may be $200 for mothers who are having children. That amount of money is substantial, and sometimes you get more buy-in. And we can also require that in the event to be eligible for that type of an incentive, that they agree to a certain number of calls with our clinical team to ensure that they're taking their prenatal vitamins, that they're following up with their OBGYN, and that all of the necessary metrics are in place for a non-problematic pregnancy and delivery. So now, with that said, I'm going to move into the recommendations. We meet with the county throughout the year, and we're always, again, sharing what's latest and greatest, what's innovative, what's new in the market. In Austin, and I live in Houston, so in Houston, Dallas, and Austin, many of the larger Texas cities have been rolling out what we call ACO plans for several years now, and they've been extremely successful in providing a large decrement or a large savings to our plan sponsors. These are what we call, the ACO is an acronym for Accountable Care Organization. And what this means is it's a program for Tenet, for example, where we would design and develop a medical program that consists of strictly Tenet hospitals and Tenet physicians, and on the in-network tier. And then there would be an out-of-network tier, but they would be highly incentivized to stay in-network due to the benefits and the lower out-of-pocket costs. When you have an ACO, there's what we call a risk share. So a lot of these facility groups have skin in the game. In other words, they are able to earn back bonuses or additional revenue based on efficiencies, such as duplication of services, labs, MRIs, complex imaging, those types of services that are costly. And the beauty of an ACO is also that it improves the member experience. For example, if you're going to a PCP or a Tenet specialist, and then you go to a Tenet hospital, those providers and those facilities all have access to the same data. And so they're able to see from a treatment perspective that what's going on. And it avoids duplication, and it avoids a lot of waste. So we have thrown that concept or that idea out on the table for the county to evaluate. And we certainly, look forward to any additional discussion or engagement around that program. Second item is we want to continue to promote the most efficient site of care, steerage or site of steerage, meaning that, promote the urgent care centers versus the emergency room. You guys saw the increase in the telecommunications or the teledoc services. I think your plan increased by 3,000%. That's not going away. I think it's something that is going to be indefinite as a result of the pandemic. If any of you have ever used the teledoc program or service, it's amazing. You can be at work in your office, you can be at home, it's so convenient, and it allows you to not expose yourself to a doctor's office in a waiting room where there are other sick people, and also not having to take what I call a day off from work. I mean, it used to be you could go into an office, a PCP office, and be seen pretty quickly, but you almost have to have half a day to a whole day because you're usually sitting in an office waiting room for an hour to an hour and a half before you're even seen. So it's something we want to continue to promote. Norma talked about the online cancer support program. Cancer was your top diagnostic category with 10.4% of your total spend. We have a new program that we provided flyers and communication or collateral on relative to cancer we call Transform Cancer. It includes additional resources and also the ability to participate in some investigational or experimental procedures that are around cancer. So that's something that we want to potentially take a look at. Norma talked about the chronic conditions. You guys are not alone. Almost every plan sponsor around the country struggles with hyperlipidemia, hypertension, and diabetes and obesity. But we still want to keep our eye on these and figure out how to work in collaboration with your wellness team and getting the appropriate communications out there to encourage people to get more engaged and more active. Last but not least is the launch back to wellness and the preventive care. You know, we are, how should I say, we are moving toward a state of normalcy gradually. I hope it doesn't go backwards. But once we are at a level of normalcy where people feel more comfortable in that face-to-face engagement, we want to work with the county to come up with a, get back to wellness, get back to going in for your MRI, your mammogram, and your well woman exam, and your annual physicals, and your colon, your cancer screenings. These are all things that for many of us we put on the back burner due to the pandemic, and we want to encourage people to re-engage in these services once we're at a state in the country where people feel a little safe and secure. So with that said, I will open up if there are any questions for our team. I know this was a lot of information. We tried to condense it as much as possible. Typically these meetings are like a half day because we get pretty deep into the analytics. But we're certainly open to any questions.
Commissioners?
Awesome. Well, we thank you for your time today.
Before you go away, one of the things that I want you to re-emphasize, if you could, please. Betsy, am I stepping on somebody?
No, sir, go ahead.
No. Okay, one of the things that I'd like for you to emphasize again is I know that my office will get a call here and there about someone going to those freestanding ERs that are not in other than Sun City, that really, if it is a real emergency, that client may get hit twice with two emergencies, one to that one, then you get transported to a hospital. And it's, in my opinion, they're kind of predatory. Can you just reemphasize why it is wise to either go to Sun City or in another direction?
Sure. I would just say that, I totally agree with your comment. They are somewhat, predatory. We had a lot of issues in the beginning with these facilities because they would do false advertising. They would make members believe that they were part of every carrier's network because they would post, banners that say, "We accept all insurance." The reality is that these facilities, if someone goes into a facility that is in a true emergency or it requires an ambulance is not going to take someone to the freestanding ER. They're going to take them to a hospital-based ER. So we want to encourage, that type of utilization. We have worked with plan sponsors in creating a differential between hospital-based ER versus freestanding ER with respect to the member cost share. And I have to pull my notes on this. I believe the county may have implemented that approach. But what it means is if you go to a hospital ER, your copay may be $200. If you go to a freestanding, your copay may be $500. So there's a disincentive or there's some discouragement there for going outside of a hospital-based emergency room. But there has been legislation that has been passed, and I believe that because of the restrictions and having to be more upfront with the truth that they're not participating, they have closed up shops, and I believe that several of them have shut down in El Paso. We still see some of them in Houston and some of them in Austin, but not near at the level to which they were present. So, and again, we can work. I think we have even developed with the county flyers, know where to go and kind of provided a flyer that shows a member from a financial perspective what it costs them from a consumer in making those decisions if they go outside of the network or utilize one of the higher cost options.
Well, thank you very much. Great presentation. Betsy or Sam, anything else?
Commissioner, we do have other items to go over under this. However, we'd like to, if we could, pause this item since Aetna has presented, we'd like to go to the fireworks item because it's time sensitive with the ESD and with Daniel, and then come back to finish this item up.
Okay, let's do
Would
that.
that be okay? Okay.
Well, thank you, Judge and Commissioners. We appreciate your time today. Have a great day.
Okay. Item number 11, receive a presentation regarding the sale, use, and possession of fireworks for the 2021 July 4th fireworks season and the county's drought conditions and take appropriate action.
Good morning, Court. Daniel Collins, Governmental Affairs Manager. Thank you for taking me out of order. I believe we have some slides that we can go to. These slides are going to walk you through El Paso County's options regarding banning fireworks and illustrate the county's current drought conditions.
We're pulling up the most recent PowerPoint. Just give us just a second, please.
Okay. Thank you, Alexis.
And for the court, Daniel, we did update the PowerPoint because of the change in KDBI. Correct, Daniel?
Yes, that's right. You had it when I originally posted the item for Thursday. That was as of the 14th. This has now just been updated just within the last half hour or so with today's KBDI numbers. Great, and it looks like the slides are up now. So we can go to the next slide, please, Alexis. So these are the three options that the court and judge have. The first option is that the county could take no action to ban fireworks, in which case all sales begin or can begin on June 24th and would run until midnight on July 4th. Option two would be the Commissioner's Court could ban just skyrockets with sticks and missiles with fins, also referred to as sticks and fins, if it does so before June 15th. And only if the county's Keach-Byram Drought Index, that's the KBDI we were just alluding to, has reached at least 575 average, which I'll talk on in just a minute. And then finally, the third option is available only to the county judge. He may issue a declaration of local disaster if we reach or exceed 575 KBDI. Under this option, the Texas A&M Forest Service would run an assessment and provide feedback to the governor. Such declaration would only last for 7 days unless extended by the Commissioner's Court. Under a declaration, the judge could ban the sale, use, or possession of all fireworks. Bans on anything more than sticks and fins is only effective for 60 hours, 60 hours, unless the county judge requests and the governor authorizes an extension. Next slide, please. So this slide shows the KBDI as of today. You'll see that El Paso has far exceeded 575. As of this morning, we were at 715 KBDI average. And I just put the top 5 hottest, or excuse me, I guess driest counties, and you'll see that we're number 2, and our adjacent counties are right there with us. Next slide, please. This next slide is kept by Texas A&M, showing that El Paso is at high risk of fire as of today. And next slide, please. And then finally, this slide is from the U.S. Drought Monitor, which shows that El Paso County is in extreme drought, that's their term, as of today. Now, mind you, neither this metric nor the previous slide from Texas A&M regarding the county's fire risk are legally significant. That is to say, only the KBDI triggers the court or the judge's authority to restrict fireworks. Nevertheless, these metrics do provide further context for the region's relative fire danger. Next slide, please. And then this is a line graph that was put together by Jacob Miles using KBDI data from the last 3 years. So you'll see those 3 lines are 2019, 2020, and then the top line is 2021. You'll see that unlike the last 2 years, we've actually started calendar year 2021 over the KBDI threshold, which is that dotted red line about the midway through the screen. You know, as you can see in previous years, it's kind of a little bit of a slow decline, and then we had the last 2 years, I think, hit the threshold number by July 4th. However, this year we started off in January under extreme drought conditions and have only gone up about maybe a point every other day or so, I think has been the average growth for KBDI this year. I'll finally note that El Paso is under a drought conditions disaster declaration. The governor, in fact, just renewed that declaration on May 7th. And that is it for slides. I'll stop here to see if there are any questions.
Commissioners? Daniel, so what is our next step?
Again, now it needs to make a choice. And again, the three choices are: you can do nothing. The Commissioners Court could decide to ban sticks and fins because we've already reached or exceeded 575. Or finally, the judge could issue a declaration of local disaster because, again, we have exceeded 575, in which case he has the authority to ban the sale, use, or possession of all fireworks. Again, if he was going to do a full ban, it would be limited in time just to 60 hours. So if he were to go that route, it would probably need to be positioned so those 60 hours coincided with the July 4th holiday, because we anticipate that would be when the most, people would be using fireworks. But those are the three options. So I guess the next step would be decide if the Commissioners Court wants to take any of those three.
Thank you,
Daniel. Oh, there you are. Okay, Judge.
Just real quick, thank you so much, Commissioner Leon. I just wanted to emphasize that that what we're trying to accomplish is that the balance between doing what's safe, obviously making sure that the community is appreciative of whatever we need to do to make it better, but also that because they are a business entity, that we figure some way that we could balance this business situation. That the numbers were quite, to me, surprising, the number of people that work and the charities that they help and all of that. So one of the things we were trying to commit is that maybe that we do eliminate the sticks and fins quickly so that they know that's not something they're going to move forward with, but then commit a little closer around the late June area, 15th of June, make a commitment as to which way we're going. I know it's extremely sensitive because when we hit the drought index, then there's an expectation that there's no alternative. I mean, there's no option because we haven't hit it. It should be banned. And that's created some issues for everyone concerned. So anyway, just wanted to say that. So I know you're going to say something, Commissioner Leon, so I'll send it back to you.
No, thank you, Judge. And really, what I was going to say is mirroring what you just said. In my experience, year after year, I'm hoping, I always hope that we can help those small businesses because, as you said, they're very involved in our community. So many young people depend on that income to make it through their school year and what have you. So in this case, I don't see that we have too much of a choice, but yes, there's some great people involved in this business, and it's just a shame that we can't help them as of this date.
Thank you.
Judge, for information, we do have a speaker signed up to speak on this item.
Okay. Thank you. Commissioner Holguin, were you going to make a comment? I know you gestured.
Yes, Judge. Actually, I was just wondering if we had Chief Esparza on the line. I just wanted to confirm with him. I think I remember from our last discussion on this topic that he did recommend the banning of sticks and fins just because those were the most likely to potentially result in fire. And so I was just hoping, I'm not sure if he is on the line, but at some point, maybe
Sure.
if we could just confirm that that is in fact his recommendation.
Perfect. Yeah, he should be on the line, but I'll go to Commissioner Stout and then I'll go to the speaker, for the public comments. Okay, Commissioner Stout.
Thanks, Judge. Just wanted to throw in my 2 cents. I think that if we looked historically at the levels that the KVDI indexes has shown us. I mean, in past years, if we've banned a lot of these fireworks when we were barely over the threshold, and now we're way over the threshold, I just don't see how we deviate from that. I understand that they're businesses and they're helping folks, but I mean, we need to. Public safety should be number one. public safety and lives are I think should be king here when we make these types of decisions. And sometimes I get really frustrated when you have businesses that can cause harm to communities, and they try to buy us off and shut us up by saying, well, you know what, I'm giving money to nonprofits, and we're trying to be good community partners in that manner, and that's great, but I don't think that we should give that I guess more importance than what our duty is, which is to provide public safety. So
thank you. Thank you, Commissioner. Miguel, would you mind just getting for public comment, our next guest, please?
Yes, Judge. The person we have is Ms. Lucinda Cuellar.
Hi, Linda. Welcome.
Hello, Ms. Cuellar.
Ms. Cuellar.
Hey. Yes, hello. Good morning, County Commissioner County Judge Samaniego, and all the county commissioners. And I can see what you're facing. Last time I suggested a bond that vendors post. I also suggested that people sign in when they buy fireworks. I've forgotten that as a retired educator, we've forgotten the education part. This is where all the entities, animal services, police department, fire department, county, city can come together and approach all the schools and provide an educational plan, a plan that teaches the kids, starting from pre-kindergarten up to high schools, the use of fireworks, the correct use of fireworks, what happens when you use them incorrectly, and how much it takes from everybody, the business entities, the private entities, the public entities, to keep everybody safe. We need to come up with an educational plan which can be taken out to the schools every year to educate the kids. I've forgotten what it is that we need to start with our kids. Our kids are our future, and those are the ones that are going to keep us going. And by educating them, the correct use, the use of fireworks, what happens if we use them incorrectly? You know what? You're not going to be facing what you're having to face now, that you're having to say no because of the dry index. You can go ahead and have provided them with the tools of using fireworks correctly, where there are not the negative results of fireworks. Still, you're going to have people that are going to use them no matter what. But I can tell you, I had forgotten the most important element. Our most important entity in our world is our children. And I can tell you, in my 43 years of teaching, thanks to my students, I had 100% parent involvement. You'd be surprised at what happens when you go through the kids. And I had forgotten, I have 6 fantastic kids in my community that we would not have what we have if it wasn't for the fact that they helped me so much. The first one's getting ready to graduate this year. I'm so proud of him. And I can tell you, that's our key. Our key is educating through all the entities, coming together and educating all our children so that they can go ahead and tell Mom and Dad, you know what, Mom and Dad, yes, let's use fireworks. Let's not do it there. And so I can tell you, if you use that approach, bringing the school systems, the police department, the fire department, animal control, county, city, coming together, you're going to see you're not going to have to go through, I'm going to have to tell you, you can't sell fireworks and you're not going to be able to get your cheerleading outfits because of the dry index. I hope that I will be more than happy to help you with an educational plan to come up with that, where every school district can be approached and every child can be educated on this, and that education is going to carry on to their parents. I know how hard you work. I thank you, and I know that you also face the positive and the negative from the community. And I pray that you will continue doing this, and please let me know if there's anything that I can help you with as far as coming up with an educational plan to approach this in another way through education. I thank you very much for allowing me to comment. Thank you all for all that you do for us, and have a good day. God bless you all.
Ms. Cuellar, I want to thank you. That was very, very insightful. It's a different angle that I hadn't particularly thought about, and but every comment, that's why we're so appreciative of public comments, because we get to hear from the constituents and the different views that they have. So thank you very much for your time and for such an insightful information. Thank you, Mrs. Cuellar.
Thank you.
So finally, you know, one of the things that when I've approached the public safety situation, as Commissioner Stout has said, one of the challenges that I've been dealt is that if everything was like we couldn't do something because of the fear of public safety, we probably wouldn't do much. For example, they use the example of food trucks gathering and creating congestion and creating potential traffic problems, and you know that do we eliminate that? Or ATVs, do we eliminate them because they're dangerous, or skate parks because they're, and so one of the things I think that very well put is that, is there a possibility to balance the public safety, you know, that comes to us, you know, that's what we're going to have to do, whatever it takes to create public safety. Is there a balance between that and being able to conduct something that might be beneficial? We also have a lot of other things that come into play. Our President Biden is just pushing really hard. Let's celebrate, you know, let's celebrate on 4th of July. This is a time of celebration. This is a time of going out there and, you know, getting the grills ready. And so we have community wanting to do these things. And, you know, how do we listen to them? And as Commissioner Stout said, how do we make sure that public safety isn't put in the line and put in front of us? So anyway, it hasn't been an easy task, and especially that at the end I've got the responsibility of making a decision on that. So we're trying to get as much feedback, and that was actually the need. As I know, Commissioner Holguin, you said that these should be workshops, not the regular Monday meetings, and so that's what we're doing today. Sort of like, let's bounce ideas, let's get, you know, let's agree to disagree, but let's move forward in the most appropriate manner. So. Did Chief Esparza come in on the call? I know he had to go out there and
yes, sir.
You've got us.
Yes,
COVID,
sir. Let me check.
Challenges.
Good morning, Judge and Commissioners.
Oh.
Yes, sir.
Excellent.
Can you all hear me?
Did you hear the question from Commissioner Holguin, Chief Esparza?
Yes, I did. And yes, one of the things that I did suggest is that if you all are considering the allowing of the sale of fireworks, that we can start by banning the sticks and fins, which is one of our more prevalent fire hazards that we have. Regardless of the decision, us as the Fire Marshal's Office for the EST number 2, and I'm pretty sure EST number 1, will still have to deal with the fireworks as they're going to be coming in from the New Mexico side, and there's no way for us to stop it. So your consideration on these efforts is greatly appreciated. Now, to echo back on Ms. Cuellar, every year, every law enforcement agency, every fire department across the nation holds Fire Prevention Week, where we teach the kids from kinder all the way to high school of what we consider hazards and why we do it and what we need to do as a community to stay safe. So those programs are already available every year, with the exception of this past year. We didn't do any because of COVID, but every year our department does thousands of kids throughout all the communities that we serve to try to encourage the younger generation to follow the safer usage of anything that has to do with fire. But yes, the services are already out there. The curriculums are already out there. So we do take pride in what we're doing, whether it's the fire department or the law enforcement agencies. They're all out there doing even career days to try to get some of these younger generations to come on board to one of these great jobs that we have. But yeah, we're working hard to make it happen. Now, when it comes to the fireworks, like I said, commissioners and judge, it's still, whether if it's banned or not banned, we will still have a task on hand to see how we're going to handle the fireworks coming from across New Mexico.
Thank you, Chief. Just want to comment that they are, in fact, the vendors who are the sticks and fins that were very open to starting off. All they want to know is give us some guidelines and we'll work with you. So anyway, just let you know that that recommendation was very well received by the vendors. Commissioner Holguin, please.
Yes, Judge, thank you. So looking at the slide that Daniel prepared with our 3 options, it actually looks like we only really have 2 options. Option number 1, to do nothing, and option number 2, to ban the sticks and fins, because the 3rd option, really, Judge, that's going to be your call, which I imagine is probably still too soon to get to that point. But I feel like, based on Chief Esparza's recommendation, I imagine that we can probably all agree that at this point we do at least want to ban the sticks and fins, even if we continue to have this conversation as we get closer to the holiday. But it seems to me, again, just based on Chief Esparza's recommendation, that at this point, of the 2 options, the do nothing and the ban sticks and fins, perhaps we do want to go ahead and consider banning the sticks and fins. I think it's safe to say we can probably all agree on that as a minimum.
I think so. Daniel, do you see any, from your legislative understanding or what you've talked about, at what point can we ban them, sticks and fins, or something we could do now, or is it something we have to wait for something that triggers our ability to do that?
You have reached the drought threshold, such that you could issue an order. We, of course, haven't posted one, so I'm sure the county attorney's office will say that we need to post that, and I can't imagine we can do that earlier than Monday. But we have until June 15th for you to issue that order. So there is a bit of time between now and then to issue the order. And just as a point of information, the Commissioners Court did, during the winter season, also issue a order banning sticks and fins. During the last summer, the judge prohibited all sales in the unincorporated areas, although last summer I think was a different case because we were also concerned about COVID-19 and gatherings in the unincorporated areas. But just as a point of information, during our most recent fireworks season, the Commissioners Court, faced with drought conditions, did also ban sticks and fins by order.
Thank you. And for me, it's better because we promised, the more things we get off the table quickly and that they know that that's one off the table, that's one more important thing for them. Betsy, go ahead. You had a comment?
Judge, I was just going to say exactly what you were saying. The sooner we can notify the vendors, the more that would help them of your intent to issue the order.
So maybe we could post that for Monday for action.
I believe Chief Esparza had another comment, maybe?
Just let me get to Commissioner Robinson first, and then Chief Esparza. Commissioner Robinson, go ahead.
Well, from my perspective, I say do nothing is not a viable option. We need to do something. And now, with understanding as far as public safety is paramount in all cases. But when you talk about education, the Chief Esparza indicated that the education is out there. Fire prevention safety has been a long-standing program that has been taught in the schools for years. But we have to do something. But at the same time, I would say that we can't be too penalize the vendors and say we're not going to let you do anything. But education starts at home. So we can say, well, we need to educate the kids, but repeat, education starts at home. So the thing is, it is imperative that how do we get the message to the parents of the kids? Because the people who are purchasing those fireworks are the adults more so than the kids. Now the kids are utilizing them and taking advantage of them, but the education of the kids, but the education starts at home. But so do nothing is not an option. I would go with the recommendation based with the Chief of Sparta made in regards to just the banning of those items that are specified.
Thank you, Commissioner Robinson. Go ahead, Chief Esparza.
Commissioners and Judge again, good morning again. Just to touch base, I think all the vendors were willing already to forego the sale of sticks and fins so that you didn't have to take any action. And I believe one of the vendors is trying to get online, but he didn't receive the comment. So I'm trying to forward him the link. He's trying to comment if he's able to join, if you want more comment.
Personally, I would like to make it a formalized action. I think it would be better for us to establish that. And then that way we've got it on record as to our position to it. So I understand they're willing, but I think we also need to formalize that decision. But Miguel, do you see anyone trying to come online?
We don't see anybody.
Judge, can I? Sorry.
Go ahead.
I was just going to, if I could jump in, just following off of what the judge said. I'm being told by our county attorney's office that we are, and this is correct, sorry, we are posted for action on this item. So I'm being told that if you wanted to make a motion to ban sticks and fins, I think we are able to do that. Erica, are you available just to confirm that?
Hi, good morning. Yes, Judge and Commissioners, Eric Rosales-Negaglione, Assistant County Attorney, correct. So Daniel had mentioned earlier that we'd have to post for the motion, but actually on the agenda, there has been posting for appropriate action for this item. And so with Mr. Collins' recommendation, if the court wanted to, it could make a motion to ban sticks and fins if it wanted to at this time.
Thank you, Erica.
Would we,
pleasure. Thank you.
Then, Eric, just sorry, I have a question, I guess. Is it then just a matter of the judge, because I can't write up the order following this meeting. It's just a matter of him then signing the order following the Commissioner's Court action?
So we have Assistant County Attorney Jennifer Vandenbosch on as well, and she's been working with Daniel on this matter. Let me defer to her for 1 minute. Daniel, Jennifer, if you're on.
Yes, good morning. This is Jennifer Vandenbosch, County Attorney's Office. We would just need to prepare the order for the judge to sign, depending upon what the motion is that the court passes.
Excellent. Thank you. Well, we'll wait. Let's hear from one more speaker. I think we're trying to get a hold of them. If not, we'll move forward. But Miguel, any luck?
Chief Esparza, who's the person that wanted to speak?
Fernando Viramontes with TNT. I forwarded him the number.
Okay.
Call in.
It hasn't come in yet.
He did reply that he's okay if you all ban the sticks and fins.
Perfect. Thank you.
And Judge, I think it would be, I think it would be a good idea. That way they know what direction we want to go. So I make that motion as described by our county attorney's office.
I'll second.
Thank you, Commissioner Holguin.
Commissioner Holguin.
Aye.
Commissioner Leon.
Aye.
Commissioner Stout.
So the motion is to ban the sticks and fins, right, Commissioner Leon? Okay.
Yes.
Aye.
Commissioner Robinson.
Aye.
Judge Samaniego.
Aye.
Motion carries.
Thank you so much. I think we've reached one level that they've got at least some guidance, and we're eliminating things that are of concern to us. So I think we're moving in the right direction, and we still have time to decide going further. So I don't know, Betsy.
Thank you, Judge, Commissioners. We will work with legal and get the order prepared, and then make sure that the community is aware as well.
Thank you so much. And thank you, Commissioners, for working through this. Okay, back to you.
Thank you, Daniel.
Thank you, Daniel. Appreciate your time and a lot of work on this and the contact with our vendors. It's just we owe it to anybody that's interested in our help or our views, etc. So thank you. Okay, Jennifer, who's there? Jessica.
Would you like to go ahead and go back to the HR item this time?
Please.
Okay, item number 4, receive a presentation and discuss and take appropriate action on the County of El Paso Health and Dental Plan Design and Premiums for Plan Year 2022, Employee Benefits, Liability Insurance, and Employee Supplemental Pay and Leave.
Hello again, Judge, Commissioners. Sam Trujillo from Human Resources Department. The presentation you heard earlier today from Aetna is actually a shortened version, believe it or not, of the presentations that we received from Aetna during our monthly meetings. And we also provide those presentations to the risk pool board as we develop new strategies to address the issues that like what was presented today. So first, want to thank the court for giving us the opportunity to provide that information in that format. We don't often get the chance to have the clinicians talk directly to the Commissioner's Court, and I think it was valuable information to hear today, so thank you. So hopefully in about 10 minutes, I would like to go over our existing plan and programs that we have designed already to address some of the issues that you heard this morning. And then I'd turn the presentation over to our medical consultant for the 2022 projections. And then finally to Berenice Acosta, our benefits supervisor, to provide the court with our plan recommendations for 2022. So Miguel, can we go to slide 56? Next one. Right there, thank you. So Commissioners, before you on this slide is a variety of benefit options that are currently being provided by the county through the Human Resources Department. I'm not going to go over each one of them. I just wanted to highlight the different benefits that are being offered. For this part of the presentation, what I'd like to focus in on is the medical and dental benefits only. Next slide. So under the medical plan, the county is currently providing services to county employees and their dependents and to retirees pre-65 and their dependents. We have 2 plan designs for employees to choose from, the core and the CDHP. We used to have a 3rd plan, which we called the buy-up plan, but this plan was eliminated due to the high cost of the plan for both the county and for our members. And we heavily marketed the CDHP with the high deductible, which is our high deductible plan, with a health savings account, which is the lowest cost plan for both the county and for our plan members, which we'll show you the court in an upcoming slide. For medical eligible retirees that are post 65, the county offers through Aetna a group Medicare Advantage plan. The total monthly premium is currently at $217, and the county subsidizes 50% of the premium, which means the retirees on this plan only pay about $108 per month to participate. This is private insurance through Aetna, so the claims and contributions are not paid by the risk fund. Aetna does assume the risk on those claims under this program. For employees and non-Medicare retirees that choose the core or the high deductible plan, they have the option of participating in one of 4 tiers: employee only, employee and spouse, employee and children, and employee and family. We do examine other tier options, which we will discuss in a later slide. Next slide, please. So this slide represents a lot of notable accomplishments that we've had in the past year that were a result of the prior risk pool board and Commissioners Court decisions. Included in this is the update to the 2021 Strategic Health and Wellness Plan. We update this wellness plan annually in an effort to continue improving our employees' healthy lifestyle, which now includes virtual programs and options for health risk assessments. The Health and Wellness Plan experienced an increase in participation, which included 847 of employees participating who are receiving detailed information on their individual health score, and we saw an increase in membership participation in wellness education as staff provided 116 training sessions to over 1,400 participants this year. We had implementation of the medical and dental network and telemedicine program in Mexico. This was for those members who were seeking services in Mexico. The networks began in January of 2020, and after a couple months, we saw the plan and our members were experiencing an increase in cost savings, which came to an end when the border closed during the pandemic time period. We are hoping to return to those cost savings as more members begin to use these services that are available now. Staff, our medical consultants, and Aetna also developed a pharmacy program we call the Prudent RX. This is partially implemented this year, and it's already expected to have between $250,000 and $300,000 savings to the plan each year when it's fully implemented. This is a program that combines specialty copay plan design to help optimize savings from manufacturer copay cards, and it does reduce plan and member costs. This program here applies to specialty medications and includes highly utilized classes such as autoimmune, hepatitis, and multiple sclerosis and oncology. Excuse me. We also do a high deductible and the health savings account educational outreach program. We previously mentioned this as being the best option for our members and our plan. So we targeted this area in our marketing campaign. We did 4 presentations and we marketed to individuals and to groups. We sent out flyers, brochures, and had meetings. The county on this plan contributes right now $600 for each member who is enrolled in the high deductible plan with the health savings account. We also offer premium discounts for wellness initiatives. The county offers up to 6% in member premium discounts for employees who remain tobacco-free and participate in the annual health risk assessments and biometrics blood testing, where they also receive a $50 Visa wellness card. The Aetna Able To program, you heard this mentioned by the clinicians this morning. This is a program that targets our high medical risk members, which are likely to become our high cost claimants without treatment. And they provide a personal nurse that assists with one-on-one communication and works with the members to reduce the risk factors and get them out of the high risk category. And then lastly, staff during the pandemic transitioned from in-person presentations to virtual wellness trainings, which included our high risk target areas like nutrition, stress management, and cholesterol awareness. Okay, next slide. So the tables before you illustrate the enrollment history as a total per plan. The chart on the left identifies combined employee and retiree membership, which you can see has steadily increased from 2018 to 2021, with the green highlight showing our current enrollment, which is 2,500. The chart on the right shows enrollment level in the BIA plan, core plan, and CDHP. And as you can see from this chart, we have seen a migration from the BIA plan, which shows up in red and was eliminated in 2019, and the core plan shown in blue to the high deductible plan, which is shown in green. We believe the migration is due to the marketing and to the incentives the Commissioners Court approved and has been provided over the last several years for the high deductible plan with an HSA. I would like to point out that the incentive was at a $1,200 level prior to this last year, and then it was reduced to $600 for 2021. However, as you can see from the chart, we actually experienced growth that year, even though the incentive was reduced. Next slide. Okay, the county's annual open enrollment period is from October 1st to October 31st. This is the opportunity for our eligible employees to review or enroll in the current benefit elections. They receive beneficiary information, dependent information. They get life insurance coverage, and then also they provide their contact information that is also used to update the Everbridge system for emergency contacts or alerts. So now what I'd like to do is transition to our 2020 plan, year reviews, revenues and expenses. And for this part of the presentation, I'd like to introduce our benefits consultants, Mr. Randy McGraw. Randy, are you there?
I'm here.
Okay. You can take over from slide 61, please.
Okay. Thank you, Sam. So I'm Randy McGraw with Hub International, and we'll review these slides quickly, but happy to answer any questions if you have any as we go through it. So in the summary that we're looking at here, this is looking back at the year 2020, plan year 2020, which is the calendar year, just to give you a high-level overview of revenues versus expenses. And as you're aware, in 2020, in the fall of 2020, there was a infusion from the county too, as expenses started to exceed revenues. And I can't see the entire slide on the screen there, but you can see that there was definitely an unanticipated loss once 2020 closed. And as you were going through the presentation, trying to anticipate your questions, I think one of the questions might be, well, how did we get here? And when I look back last year, when we started this same meeting in May, we were looking at data that ended in March of 2020. And of course, the pandemic and other things happened. And as you heard Mr. Garza explain too, in reviewing some of the claims that are even rolling in and getting paid in April of this year, there were some significant claim expenses that were happening in December of last year. So as the border closed and we weren't able to recognize savings from the Mexican network that we had put in place or anticipated, and then as claims started to accelerate towards the end of the year, that led to the need for the infusion. If we go on to the next slide, please. So in this chart, what we're doing is comparing revenues versus expenses on a per employee basis. And it says net expenses because the county does purchase reinsurance from Aetna to protect you from a catastrophic loss on any claimant with claims greater than $300,000. And Aetna assumed $1.7 million worth of expense in 2020 for claims in excess of that threshold. So on this page, we basically got two views. One, we're looking at a 12-month moving average. You can see the red line is higher than the blue line, and that's what leads to a drain in the county's reserve fund and expenses exceeding revenues. The right-hand side of the page is a 6-month moving average, so it's more sensitive to current events, and you can see the same information just on a higher scale. So that's what we're working to resolve with plan design changes, funding recommendations, network considerations. We're not in this to make money or a profit, but we do need to have the revenues and expense lines stay together so that it doesn't create any budget shortfalls for you. If we go on to the next slide, please. So I know in Aetna's case, as they went through their extensive detail, they're comparing 1 year versus the prior year. And what these charts are showing you is a continuous flow of the information and tracking of moving averages. So for example, in this slide, we have medical measurements on the left-hand side and prescription drug measurements on the right-hand side. And so if we look at the medical, you can see for the month of March, which is the latest detailed data we have available to construct these slides, is that month of March actually reflects all claims activity from April of 2020 through March of 2021. And so it's not a how did 2020 compare to 2019, it's how are things looking closer to a real-time view. So you can also see that in 2020, the blue line, things were jagging up towards the end of the year like we described, as some unexpected expenses came rolling in. And in the first 3 months of the year, it's a little bit jagged, but as you've already heard too, in the month of March, there's a weekly claim wire that Aetna sends for claims processed, and there were 2 extremely high weeks in the month of March. And there's also been one in the month of May, and we're also anticipating that this week is going to be an expensive month as well. The good news on the right-hand side is that if we look at 2020, we can see prescription drug costs escalating pretty continuously through the course of the year. And things are starting to flatten out on prescription drugs, which is good. And Sam had referenced the Prudent RX program, where we expect to receive some additional savings from specialty drugs. So hopefully that will start to flatten out on the pharmacy. On the next slide, the view is just a combination of medical and pharmacy expenses combined. The following slide is a breakout of costs by plan. And so I know last year during the budget session and periodically from your risk pool board too, especially when we're looking at just annual data, not continuous data like this, there are a lot of times the questions come up is, should we really have the consumer-driven health plan? Does that really save us money? And this slide overwhelmingly says, yes, it does. So what we see here on the far right corner is that the average cost for each covered person under the core plan is $529 per month. For the average cost of a person covered under the consumer-driven health plan, it's $306 per month. And so sometimes people will say, well, that's just because people that don't have a lot of healthcare expenses tend to take the consumer-driven plan because it's cheaper, even though it has a high deductible. But the data here shows, even as you look back over time, as we've added more and more employees into the consumer-driven health plan, they're migrating from your buy-it plan, which ended in 2019. You can see that green bar, how expensive that plan was on a per-person basis. But in 2020, those people had to pick either the core plan or the consumer-driven health plan. And it looked to us like it was about a 50-50 split for the people from the buy-it plan picking either the core or the consumer-driven health plan. But what the graph shows us is that even as higher risk migrates into the consumer-driven health plan, it's not being reflected in the increasing cost. And that's because the consumer-driven health plan, while it puts more cost-sharing provisions on members up front, and that no benefits are paid until they meet their deductible, that phenomena also changes their awareness of how things work and their behavior when it comes time to make decisions on selecting health care. So I would say I'm a strong proponent of offering the consumer-driven health plan. I'm also a strong proponent of what the county has done in the past, which is providing health savings account contributions. And as Sam mentioned, we were providing $1,200 per year into the health savings account. This year we moved it down to $600. But there's some consideration looking forward to tweaking it down to $300, or sometimes, it even comes up, well, maybe we shouldn't contribute anything. But I think what this graph overwhelmingly tells us is it's worth the investment of the health savings account money to encourage people to join this plan so that they can make that same transition that we're already seeing historically in making wiser decisions on how they consume health plan. So that's a monthly differential of $220 per covered person. You've got about 5,000 covered people. You have 2,200 employees. So $200 in 12 months is $2,400. Contributing $600 for a person to move from one plan to the other or incentivize that, I think is well worth it, and would encourage you to at least consider keeping the $600 contribution as we look forward, or as we go forward with our discussions for the future. Next slide, please. So this is the forecast page, and I like to say, and I feel like I'm young, but I'm getting older every year. But it goes back to my grade school teachers. You got to show your math. You can't just work a division problem and give me the answer. You have to show your math. So this is the math that we're using to forecast the claims expense in the future. And at the top, there's an important note where it says total medical claims and total prescription claims. Instead of having a number, it has CDR adjusted total. So historically, what we've been doing is relying on the detailed information which becomes available from Aetna, but it runs about 30 to 45 days lag time from the time you actually get the request to pay the claim. And so with the increase in claims expense on a weekly basis, which was reviewed with you, I guess just a little over about 2 weeks ago, with the request for the ability to request additional monies to infuse into the plan if expenses exceed revenues. So what we've done is we've not just relying on the detailed data, but we're making adjustments for live real-time data. So now our forecast is incorporating numbers where we don't necessarily know all the details about what is going on, but Aetna has been a good partner for you, and that recently they've assigned a team of people, and that's what Mr. Garza was reviewing with you, before it actually hits their system where it can generate the fancy reports like we reviewed. They've got some people digging through the current data to tell us what the heck is going on here, why are these claims so high, and that's what Mr. Garza was reviewing with you when he was talking about the claim wire dates from April the 2nd and the 22nd, or whichever ones that they were. We're also aware, too, now that we've heightened the magnifying glass with Aetna, that this week is going to be a significant week also. We're expecting, they put an alert up to this to alert us that there's a claimant with a claim that reached $900,000 on one person that's getting ready to come through this week's claim wire, which is probably going to hit your auditor's office today if it hasn't already. So it's good news, bad news. The bad news is somebody had a severe enough claim to rack up $900,000 worth of expense, and it's no fun for any individual to be in that situation. The good news is that, again, the county does purchase stop-loss reinsurance to protect you from expenses greater than $300,000. So out of that one $900,000 claim, only $300,000 is going to get funded by the county, and the other $600,000 is being reimbursed by Aetna. But our average claims float on a weekly basis until the last month or so has been more in the neighborhood of $300,000. So in this week, one person is almost going to touch the average, and then we'll have the rest of the claims coming in on top. So by accelerating the information and not having as much detail in building the forecast going forward, and also given the frequency of unexpected events that are happening, our recommendation is, if we're not going to change any benefits, any networks, we're only going to solve the issue of revenues versus expenses by changing the revenue side of the equation, that it would require a 37% increase in funding. And a large part of that is driven too in that in 2020, the Risk Pool Board and the county early on in 2020 decided that they were comfortable with holding what we call a 60-day claim paying reserve, where historically we'd been funding to 90-day claims paying reserve. And that makes a difference in terms of what the actual dollars are that need to come in. Since your reserve balance has drifted down to zero, there's two things happening in the forecast going forward for next year. Number one, the recommendation and consensus of the board, and I agree with it too, is to go back to targeting to fund to the 90-day fund balance reserve, which should help, I hope, eliminate the need to have meetings with you during the course of the year saying the health fund is running out of money and we need to transfer money into it. So a large part of the increase is building up the reserve to better have the budget reflect the expenses in the future. And then the second part is, again, taking a look at the most recent claims data that we have, trending that forward into the future, and that's where the 37% increase comes. So the targeted reserve to hold is $6 million. So out of all the new money that we're looking to generate, 6 million of that is just for you to be holding in your account in case we go through another period of time where claims are bouncing up and down. And with that, I'll stop and see if you have any questions.
Thank you, Randy. I will now go ahead and take over the next portion of our presentation. Thank you, Alexis. Good morning, Judge and Commissioners. Berenice Acosta with the Human Resources Department. So based on the information you heard from Aetna this morning on our plan experience and our projections from our consultants, staff does have 6 specific medical plan design proposals for the court to consider, and they are listed before you. We would like to note that the first 3 sections are continuations of the existing plan design, which include the plan tiers, and that is the employee only, employee and spouse, employee and children, and employee and family. Please know that staff, along with our consultants, have reviewed a variety of other tier options, but the current 4-tier system still appears to be the best option for our population. As an example, under a 3-tiered system, which would be employee only, employee plus 1, and employee plus 2 or more, would move us backwards in managing enrollment risk due to the dependents children's per member per cost being lower than spouses. Specifically, under the employee plus 2 or more tier, it would attract more spouse risk, because if a member has 2 children already, it would not cost the employee anymore to add a spouse, which has a higher per member per month cost. The 3-tier system is unfortunately not a good structure to attract the child's risk. So continuing with the premium discount incentives, as Sam mentioned, we would be recommending to continue with that incentive, which is provide a 4% discount if the employee completes both their HRA and wellness screening, and 2% premium discount if they indicate they are tobacco free. Next, we are recommending to continue with the wellness coordinator and wellness fund of $100,000. And we then have the proposed HSA contribution in the amount of $300, which we'll go into further detail in the next slide. And then we'll go over the proposed implementation of an ACO network, which you heard from Aetna mention, and the proposed medical and dental premiums. Next slide, please. This slide before you is an overview of the HSA incentive throughout the years. In 2016, we implemented the $600 incentive for employees who were on or switched to the CDHP and enrolled in the HSA. We offered the $600 incentive for 2016 and 2017. And then the board, along with the Commissioners Court, approved an increase of $1,200 for 2018 through 2020. And then we decreased it back down to $600 for the plan year 2021, I'm sorry. So based on the plan we discussed last year and the continued low levels of our risk pool reserve fund, staff is recommending to continue as planned and reduce the HSA incentive from $600 to $300 for plan year 2022, but we do have options for the court to consider if they choose to stay on the $600 level. And so therefore, next we'll go over the medical and dental premiums. Next slide, please. As we discussed with the court during the May 10th meeting, our risk pool reserve fund dropped to a critical level in plan year 2020 and remained at a critical level for most of 2020. This caused us to implement our contingency plan, which included a request of $1 million from the county's general fund to be used to replenish the risk pool reserve fund as needed. So therefore, based on the information we have today, along with using the projections discussed with the court today, staff is proposing a premium increase determined by using the 90-day risk pool reserve target and using the proposed $300 HSA incentive. Based on those factors, staff is recommending a 36 premium increase for the medical plan, which is reflected on this table for both the core and the CDHP plan. However, staff has provided several options should the court desire to contribute more towards the fund, which would reduce the premium amounts for employees. You will notice that dental is not reflected here as we are not proposing any changes to the dental premiums. Next slide, please. In this slide here, we're showing the contribution percentages should the court desire to contribute $600 versus $300 towards the HSA. This is normally where we would end our proposal and recommend the Commissioners Court set those rates. However, staff, our benefit consultants, and Aetna have looked at other potential options for the Commissioners Court to consider for plan year 2022, which would reduce the overall impact to the risk fund and to our members in overall cost. As you may recall, last year, staff did inform the court in June of 2020 that staff would be looking at potentially implementing an ACO or a narrow network, which you heard from Aetna explain, for plan year 2022. Next slide, please. So in looking at those options, the idea was to use the existing core plan as our traditional plan for members that want the option of going to any provider and develop an ACO or narrow network plan for members who are only using certain providers such as Tenet, HCA, or UMC. According to our member utilization data, most of our members predominantly use Tenet hospitals and therefore have contracted with Aetna for an ACO network. By adopting an ACO network, the county could see anywhere between 8 to 15% in claims expenses reduction, or between $500,000 to $1.2 million reduction in a year. The actual savings amount will be dependent on how many members join an ACO network plan. The members who join an ACO network plan would see a lower premium than what they would see using the traditional plan. One of the first questions that comes up is, what about the county hospital UMC? UMC is already a preferred hospital provider within our plan, and members under this plan that utilize UMC providers already experience a higher savings in claims due to the coinsurance of 95.5, which we'll explain in further detail in the next slide. Next slide, please. So the intent of an ACO network is to allow members who are currently utilizing Tenet hospital providers to join a plan with a narrow network, allowing for a lower medical premium for members and at a lower cost for our medical plan. Basically, we can reduce the cost to both the county and to the members who have already chosen to use Tenet hospitals instead of using our lowest cost plan option, which is UMC. We would like to note that UMC does not contract with many of the providers our members are currently using at other hospitals such as Providence. Based on the analysis conducted, 51% of our plan members are already using Providence hospital providers as their primary provider, and if we have 50% of the members join an ACO network, the fund could see up to a $1.2 million annual cost reduction in medical claims. If the court supports this plan, we would recommend adding 2 additional plans to our existing core and CDHP plan. The 2 additional ACO plans would become a core ACO and a CDHP ACO. Therefore, we would have 4 plan options. 2 would be open networks and 2 would be ACO networks. We have added information under each plan to best describe what those differences are between each plan. Specifically under the core plan, which is our traditional plan, Open network plan members under this plan will have a higher savings using the UMC providers, as it will continue to have the 95.5 cost share, and will have the international plan, which also saves the member more in claims cost. We would also like to share that our benefit consultant currently has clients who have established an ACO network, and they have seen a 10 to 12% decrease in claims cost thus far in a short period of time. There are pros and cons in implementing an ACO network. The pros would be savings to the fund and to the member. The cons would be that the ACO plan would limit the plan member with options of seeking services, as they would only be limited to using Providence providers. Anything else would be considered out of network. So we do want to note that this plan is not for everyone. It would be ideal for those members who are currently seeking services with Providence. So if the members are currently utilizing UMC providers, it is best that they remain in the traditional plans, as they would see a higher claims savings. Our goal is to provide an additional plan option for those members who are currently utilizing Providence providers, which in turn will bring savings to the member and to the fund. Next, we'll be going over what the 4 plan option premiums would look like. Next slide, please. If the court approves the implementation of an ACO network, the overall county budget impact would drop from $5.1 million to $4.1 million in a fiscal year, assuming at least 25% of the members migrate to an ACO plan, which is half of the members that are currently using those Tenet hospital providers, and if the court desires to contribute $600 towards the HSA. The budget impact figures for a $300 HSA contribution would go from $4.9 million to $4 million. We would like to note the more members join the ACO plan, the more savings the plan would experience. Claims expenses under the ACO is expected to be reduced by 13% on average. However, because we don't know how many people will enroll in the ACO or narrow network, we believe it's prudent to budget conservatively, as if we're not implementing a narrow network this first year. Under the next 2 slides, we have provided options for the court to consider should the court desire to contribute more towards the open plans or the PPO plans. So if we can move on to slide number 76. There you go, thank you. So lastly, we would like to share with the court that with the current county employee rate premiums, what those look like as it compares to other local entities, and compare the rates should the court approve the implementation of an ACO network. With a 37% premium increase, you will notice that the county's employee premiums would still be comparable or competitive in many of the tiers. We know that this was a lot of information covered with the court, but at this time, does the court have any questions for staff or for our medical consultant?
Well, Benenisa, just one comment that have been, this is a big part of my life in HR, and this is one of the most comprehensive. Benenisa, it's very well done, and the presenter is just a very, very comprehensive, gives us a tremendous insight as to what we're having to face. Just want to add and encourage that we have to be a role model in our community of dealing with some of the challenges that we're going to have as we move forward. Delayed treatment, I'm sure our county employees have done the same, where they're concerned about COVID, didn't go get the treatment that is required, and so we have those challenges, and I think we need to really look at that and say what do we need to do there. The other one that also that we are a role model is that we're doing everything possible to identify that we had huge vulnerability gaps and cracks in our healthcare system as far as taking care of our community. I've been emphasizing that we had 2,000, we're one soul to be at 2,600 that have died in our community, and with the underlying issues that existed. We're very vulnerable community. Just came off of welcoming an initiative of looking at all these factors. So just the encouragement really is, Berenice, that we really focus on prevention, and that we really focus on making sure that the wellness program, I think that was very well received, and but everything that we could do to identify some of the potential vulnerabilities, and say if there was another COVID hit or some virus was to hit, how would we fare with regard to taking care of individuals in our county that have diabetes or that have heart issues? That they were the two main components that really hurt us throughout the COVID, and ended up at, from hospitalization to ventilators to initially, passing. And so whatever you could do to encourage, how do we make sure that we look towards the future and some of the challenges we're going to have, but prevention is going to be such a key component. So anything that you can combine and help us with as far as prevention and educating our county employees. And hopefully, as we know, they have families, and if we do the right things with them, we have such an impact on their own families and their extended families and friends. So I just want to thank you for the presentation and the backup, just extremely comprehensive. I know it's a lot of material, but I can tell you from my exposure in HR, this was a very well done, presentation and backup. So thank you, Berenice, for heading this off, and Sam as well, and Melissa and everybody else. Commissioners, any comments that you'd like to clarify at this time? Commissioner Holguin, please.
Thank you, Judge. Hi, Berenice. Good morning. So, I just want to make sure I understand. Regardless of whether we adopt the ACO, we're still looking at about a 36% premium increase. Is that correct?
If yes, so to speak, if we don't implement an ACO, that's the total rate that we're looking at. But if we do implement an ACO, it would be $1 million reduction. So there is going to be a difference between ACO plan premiums and PPO premiums. So you'll notice on the slide, and I believe it's slide number 73, the premiums for the open networks are going to be higher than those from the ACO.
So that leads me to my next question. So looking at for example, the current CDHP for employee and family, that's $277. Once we do the rate increase for next year, if we do it, it goes up to $407 for the same employee and family. And then under the ACO, it's $342. So we're incentivizing our staff to go to the ACO with Tenet and not staying with UMC. I mean, I thought that if we encouraged more of our members and employees to stay within the UMC system, that was what provided the most savings. But it seems here like we're going to be incentivizing people to actually move to the ACO and away from UMC. Am I not understanding that?
Actually, our goal is to target those individuals who are currently seeking services with Providence. So we're not trying to incentivize those who are currently using UMC to move over. It's only focusing on those who are currently using. However, for the open network plans, the member themselves will see a higher savings if they use UMC providers. However, the fund itself will not see savings. So it's a savings to the employee, not a savings to the plan, if that makes sense. And I think, Randy, you have your hand up, so I don't know if you want to chime in.
Sure, thank you, Commissioner Holguin. So one of the key differences is that the ACO, the Accountable Care Organization with Aetna, has received improved or lowered or greater discount pricing with Tenet. So in a quick description, the offer and the deal sounds like this. And when the two parties sit down, Tenet says, we'd like to get more people come into our facility. And Aetna says, and we'd like to spend less money if more people go to your facility. So in the agreement, Tenet has agreed to reduce their pricing in trade for exclusivity. And so that's what's driving the price difference, or the incentive, as you described it, is the cost for payroll deductions would be lower because the same care under the ACO contract would be cheaper than without the ACO if they went to tenant. So that's what's driving the price differential. And UMC is definitely a good provider. They have great quality scores. And so what you're seeing in the rate table is really a reflection of the cost. And I would say we could invite UMC to come back and say, well, we would rather have a lot of exclusivity too. And then our response would be just like Aetna's, then give us a better price so the cost goes down, and we'd be happy to do that.
And I understand the ACO, and I understand that there's a lot of employees who already get services from Providence. And so I think that that's great to have this option for those employees. But I'm just thinking, if I'm an employee that normally gets services through UMC because it's been explained to me that that's generally the best. I mean, if my monthly premium for my family is going to be so much higher if I keep doing that, I mean, I don't see why I wouldn't want to also move to the ACO to try to save on that monthly premium. So that's what I meant by, aren't we actually incentivizing our members from leaving getting care from UMC and moving to getting care at Providence? Because they would save on their monthly premiums.
I can see what you're saying there. So the rate is not really the incentive. And then kudos to the county, too, for thinking ahead of its employees. My original recommendation was to make the spread wider if it's all about saving money. But then when it comes down to, and I'm the same way, I don't necessarily buy the cheapest hamburger or the cheapest toilet paper. There's quality and access and other considerations that go into consumer decisions. So I would like to think that the true incentive the county has is funding the consumer-driven health plan. And in the consumer-driven health plan, for those members that are not in it already, by migrating into the consumer-driven health plan, their cost goes down. They receive funds from the county to help them pay their share of the cost. And the money that they save in their own premiums, they could also redirect into their health saving account. And that's the real incentive, I think, in the county's program, is educating people how to be better healthcare consumers. And then in the offering, the county is still giving people a choice. If you want to use UMC or HCA facilities, then you certainly can, but it comes at a higher cost. And so in the chart that Veronese was reviewing with you, the contribution strategy from the county is already higher. So that note at the top of the chart says the county will contribute more money to people that choose the UMC open PPO network, and that more money is 5.5% higher than the chart she showed you for the ACO. So, to me, again, because a lot of our clients, it's all about dollars and they don't really care about access and things like that. But in this case, you can subsidize the UMC option by increasing that differential. So I know we've worked up a lot of other alternatives too. So this is what it would look like if the county contributed 5.5% more. But there's also some other illustrations if you wanted to incentivize it a little higher, how that impacts your budget too. So I think we ran some for 8% and 10%, and let Veronese take that back over in the discussion. So the board, the risk pool board, and HR is definitely sensitive to employee needs. And while dollars are important and budgets are tight, they're definitely sensitive, and that's why they created options for you with higher incentives to go that direction.
Yes, thank you, Randy. And those you will see under slide 74 and 75. You'll see where if you contribute more towards the open network plans, if the county contributes more, you'll see that the premium itself, so for instance here, it's the 8%, contributing 8% more, towards the PPOs. So you'll see the current, for example, CDHP employee and family, 277 employee and family. Then the traditional plan would be 395. And if we go on to the next slide, you'll see that this would be the 10%. So should the court want to contribute 10% more towards the PPO plans, then you'll see the premium difference there. And at the bottom, you'll see what that budget impact would look like should the court desire to contribute more towards the PPOs. So I don't know if that helps. Definitely, if the court wants to contribute more, we also have what those dollar figures would be.
I guess I'm just really, really worried about the 36% premium increase for our members, because we have to remember these figures that are in these charts are bi-weekly, right? So that means that it's deducted from each paycheck, so 2 paychecks. So, I mean, presumably, if we do this in 2022, I mean, you're going to have members pay a little over $800 a month, as opposed to a little less than $600 they're paying right now for their families. And it seems like maybe we need to do a better job of educating our members on how to, you know, like we were talking about the standalone emergency rooms, and that's a huge cost that folks are going to those, and they're not in network other than Sun City. I mean, I'm just wondering if there's more that we can do to make sure that our members understand the benefits. And the reason that I ask that is because, for example, so I just very recently joined the county plan, but I understand, of course, we're in COVID right now, staff isn't in the county courthouse, but I haven't received any type of sit down with anyone explaining to me how, you know, I can save money and the county can save money and the choices that we all make. Do we normally do that for members?
Yes, and it's usually before open enrollment. We hold different sessions where we bring in our Aetna team. We do have an on-site representative who does presentations, and and they explain how the plan works, that we are self-funded, and how the claims that we're paying affects not only the employee premiums but also the contributions from the county. So we do hold different educational sessions that we give the opportunity for employees to attend.
Well, I'm just really concerned, Judge, about such a significant premium increase for our members.
Commissioner Holguin, this is Melissa Carrillo with Human Resources. And Berenice, if you don't mind my interjection. So, Commissioner, please know we all share in your concerns. We definitely don't want to be in a position where we have to bring premium increases to the court. When we look historically, and this is something that I do on my own every single month, even though I know my team does it, because I too am conscientious of where is our money going, what happened to revenues versus expenditures. You can see over the past few years where our expenditures were absolutely rising above our revenues slowly but surely. And when you look back on premium increases that we did give our employees, ideally, we probably should have been increasing incrementally over the past few years a little bit more than what was done. And I say that because right now, you're right, we're in a position where we're recommending a 37% increase, and that is extremely high. The last time we did a 30% increase was many years ago. We have done it. We did that. I remember when the county used to give free health insurance to its employees and charged $0. And at some point we couldn't sustain that anymore. And so we came in with some premium increases. And so this isn't a position we want to be in. We definitely want to keep offering those programs. We know that we need to tighten up our education with our employees. One of the things that was mentioned yesterday in the risk pool board meeting, and I really appreciated the comment, was, you know, you keep hearing we're doing everything right. And I know it's frustrating. It is so frustrating for me because my poor staff hears me say, okay, well, if we're doing everything right, then what's happening? And the idea, there's a third prong to everything. It's putting into programs into place, but member engagement has to be there. And when we're sending out emails and postcards, or we're making a phone call and not following up, we need to drive member engagement by really launching a strong marketing campaign, not just once a year, continuously, where we're in their faces all the time so that they know this is your plan. How can we help you make better decisions continuously, so that you know the difference between a freestanding clinic and an emergency room and a hospital visit? Because they don't. I mean, I know several people work in HR and even they don't understand it. How do we expect other county employees to understand this stuff? So we know we have work to do with the education piece for sure, but when it comes to the funding, even the impact of these programs, they're not going to give us the revenue to cover the expenditures unless we do something drastic. And I know the court is so grateful to the court for taking care of its employees. We don't want you making decisions that are going to impact their paychecks. I know you'll start receiving phone calls from them saying that this is unfair and this is too high. We know that, but we are doing the best we can to keep those numbers as low as possible. It's going to be a mix. It's going to be a mix of things, not just money, but it's also going to be our member engagement. It's also going to be the programs we offer. But unfortunately, we need money. You know, we're at that point where until we get to a $5.5 million reserve in our risk pool fund, which is what our 90-day reserves look like, then we're going to keep asking for money every few months. And I definitely don't want to be doing that. So we are in a position where we need to do something drastic. There are some options to get that amount of money. As Berenice continues to say, if we want to see about the general fund or the county contribution increasing so that the employee contribution is not so high, we can look at that. But we definitely have to elevate revenues, or at this rate, we won't continue to cover those expenditures. And then also just to remind you, there's a small number of claimants that are driving this. You heard so much, and I know we've talked for hours about this morning, but it's such an important topic. It's those high cost claimants. It's 7 people, it's 9 people. You heard from the RN this morning that said they targeted 7 people last year and said, hey, you 7, we're really worried about you. Looks like something catastrophic's coming, and would you like to be part of this program? And 2 people graduated. So we will continue to focus on those high cost claimants because that is what's driving our number. We have quite a bit of employees who are doing their part. Last year, training was up. Wellness participation was through the roof. People realize the importance of good health, especially amidst a pandemic. That was their only armor, if you will, to get through COVID-19. And so I love to hear that we're doing everything right, but it's frustrating. And I completely echo your sentiments.
We can't make member engagement mandatory. I mean, we did hear those stories about trying to reach out to some of those high cost claimants, and there was just no response. And apparently, I guess, we just kind of left it at that. But we can't make member engagement mandatory if we know that that's going to help us keep our costs down.
Commissioner Olguin, I do know that there are some rules about certain types of member engagement. This is a goal that I've had with Melissa and Sam for some time, working with Aetna. I do think one of our next phases of our wellness program does incorporate this, but we need to get there quicker. So what I've seen done is agencies actually, if you get in this program and you start making measurable changes in your health, you get incentive such as a reduction in your premium or an additional HSA contribution or some other type of, people love leave. They love, if you can hit these goals, we're going to give you more leave or some other employment incentive. And you do it for this targeted group just because we want healthy employees. Healthy employees are productive employees, obviously. So there are programs out there that have been done that do that. We just have to be careful to not punish people for basically not engaging on their health. There's certain rules on that, but I know Commissioner Leon, you also had a question.
Go ahead, Commissioner Leon.
Commissioner Olguin, were you finished?
No, I was just going to say, I hope that is in fact what we are moving towards. When could we see that actually happening?
So this is the perfect time. This is the feedback we need from you all so that we can definitely take it back, work with our consultants as we build the FY22 budget. You know, every year Betsy always asks, be in a position by May to let the court know what premium rates look like. And that's what we wanted to do for y'all today. Of course, taking your feedback and seeing, is there anything else that can change this? When it's time to make those official budget decisions, we'll bring those back to you. So good feedback, and we'll take it back and see what we can do in terms of incentivizing engagement.
Thank you. Commissioner Leon, and then Commissioner Stout, please. Go ahead, Commissioner.
Thank you. And just a quick reminder that the high cost claimant may not be an employee, may be a family member of our employee. So it's probably even harder to reach. But I agree with Commissioner Holguin, 37% is way too high. We have got to do something to bring those costs down. And I think I asked this before, Betsy. In 2020, in all the claims that we have here, were there a lot of COVID-19 type cases that we can use, federal money to offset some of our costs?
There are some. There might be in a possibility. I saw some wording in the ARP guidance that it can cover medical expenses. I've shared that language, I believe, with Jennifer Vandenbosch in county attorneys. I know Melissa's also, I shared it with Melissa as well. I know they're looking at it, that could we recoup some of those costs? You heard about a claim from Randy on the weekly update that will be hitting probably today that's related to COVID as well. So I do believe we're at approximately just over $2 million worth of claims that could be reimbursed by funding through ARP, possibly. We're still evaluating whether or not, how far retroactive it can go and whether or not those claims will qualify.
Yes, I think we need to be very aggressive in that end. And also, I don't know if Sam or you, Melissa, can answer this, as we educate our employees as to how to stay healthier, how to avoid COVID, that these costs can also be attributed to, that we can use some of the Fed money. And I've got to tell you, in my circles, I've learned that many more than I wish are totally unfamiliar with a health savings account, what it can accomplish, what it's for. Many of them thought it was only the employee that can use it. And once you retire, you lose it. There's all sorts of misconceptions that I was taken aback is how many employees we have that would love to be in this program, but they just don't know that it has many more positive effects than what they think it has.
Thank you, Commissioner.
Yes, sir.
Commissioner Stout?
No, thank you. That's all I have.
Thank you.
Commissioner Leon, just know absolutely we are working on changing lots of things, shaking things up in terms of our communication and engagement approach. We know that is the key, that is the root, and we're going to focus hard on it coming up very soon.
Thank you, Melissa. Commissioner Stout?
You're muted,
You're muted, Commissioner Stout.
Sorry. I have a lot of the same concerns, and I appreciate Commissioner Leon bringing up the idea of using federal funds. I think that's a great idea. I also, something else that also gives me heartburn is that so for example, somebody who decides to stay on the CDHP plan who doesn't go to the ACO. I'm looking at the line where it says, the employee and children. So they're going to pay an additional 55% premium in their premium, and then also we're looking at reducing again the amount of money that they're going to be getting with the yearly contribution that the county gives. And that gives me a lot of heartburn, because in a year where we had a lot of issues with COVID and we're just taking a lot. We're taking a lot. So, you know, those that gives me heartburn, and it's not something that I really want to see done, right? You know, I think that we should at least keep it at $600. And I mean, by looking at the chart that Mr. McGraw showed us earlier, it's even I think better if we did 1,200, because we keep that keeps pushing people to the CDHP plan, and that's what we've been wanting to try to do over the years. And by dropping it to 300, I think we start erasing some of the gains that we've made. And you know, I think that chart that was shown to us is quite evident of the success that program is having. And so I would advocate heavily for you know, rethinking the reduction of the contribution. Just one question of clarification: the 37% increase in premium cost, that is, you're talking about, that's what it would count the cost the plan or the county, right? That's not the, is that what we're saying is the, or is that 37% that you're talking about an average increase for what employees would pay?
The employees themselves would see a 37% increase to their premiums. Now, of course, the county contribution would be increased as well to elevate what they normally contribute for each of those plans or each of those tiers. But the 30% is literally what an employee's paycheck would increase. And those rates that we closed with, those are the rate changes which embed the 37%.
Okay. Yeah, because I was just looking at the same line. And again, if folks stay on the regular the current CDHP plan, it's a 55% increase. And so we are, if we're not trying to, we're definitely indirectly incentivizing folks to go to the ACO, because it's a 25% increase for them on that same line. And so we may not be saying we're trying to do it, but that's I think Commissioner Holguin talked about it a little bit earlier too, and that's what it looks like. And so. And I'm also, did I understand that with the ACO, all of the work that we did to create an option for folks to go to Mexico or to have telemedicine in Mexico would not be an option anymore? That would be erased?
No, Anissa, correct me if I'm wrong. Those who do the ACO still have the option of participating in Mexico doctors and physicians, correct?
Okay.
No, actually, the ACOs doesn't come with the international plan. It's the traditional core plan that would remain with the international plan. And I believe Randy has his hand up. I don't know if he wanted to chime in.
Commissioner, do you need to say anything else before we go to Randy? Or?
He may be answering or commenting on my comments, so that's fine. Let's hear from him.
Thank you. Go ahead, Randy.
Sure. I just wanted to clarify the question about the percentage change of increase too. So percentages can be deceiving sometimes depending on what you're comparing it to. So in the presentation, before the discussion of the ACO, there were several slides. There were two, one that showed a 36% increase and a 37% increase, and that was without the ACO. And in those two illustrations, the county and the employees would bear the same percentage increase of 36% for the, I'm looking here at what we have. Okay, yeah, no ACO. So you can see there that in the first column, it's a 36% and a 36% for both the county and the employees. And then you can see there were some other illustrations too that showed the actual percentage change for employees. And those are all just being driven by how much money the county assumes. So there, for example, in the top row, that's the increase, I would say, across the board for the entire rate. And so it's 36% no matter what. So as you move from left to right, what you see is the county absorbing more of the increase in the middle. So the county would perceive 42% and employees would perceive 15. And then on the far right, 10 and 43. And that's kind of where we ended up last year under the budget process. Was same discussion. The county was concerned about the impact on employees. So you made a decision to absorb more of the increase so that they could absorb less. So when you're looking at the ACO versions too, then it distorts those percentage figures. So I just wanted to make sure that we were clear that as you move one category and not the other, the percentage changes will change. So it's not the only time you can say it's 36% for everybody is when we're looking at a model like you see there on the left-hand side. Just didn't
Randy,
I want to make sure you're clear. Yes.
I think we're referencing the rate sheets, which
Yes.
show different increases based on tier.
Yes.
Right.
Yep. So, but I was just using this slide here as an example for how things change. So in the ACO models, we had 3 different categories that were showing. One was, I think that was going to be the slides Berenice had. Yeah. Another, go forward, please. Yep. So there you can see on the top portion, so the county's contribution strategy in the past has been based on dollars to the ACO or the consumer-driven health plan, and then whatever the fixed dollar amount was, it was the same for the core plan. So you can see that on this slide here, on the left-hand side where it says current, you look under the county's contribution, you see those numbers, $239 for employee. When you look over at the core, it's the same $239 per employee. And if you look at the proposed ones, and now we have them above and below each other. So under this scenario, we've set the recommendation for the consumer-driven health plan at $295, but increase it more for to subsidize the open access PPO dependent rates by raising the county's contribution to $311. And then if you were to look at the 2 slides following this, you see what's happening is the county picking up more of the tab to lower the percentage impact. So it's not really a safe assumption to just say, when I say 5.5 or 36 or 37, that applies to every category across everything that we're looking at. So those percentage differences are going to vary depending on which model that you look at.
Randy, I think what would help, because obviously it depends on the impact we take and the impact that it's always the case, right? Anytime you have an increase, you have to, how much are we as an organization willing to offset, and how much are we willing for the employees? But I think also, I think if you could reiterate, because I was in and out a little bit, but how do we compare? I mean, what's happening on a national scale and what's happening, I don't know if you can say locally, but what are some of how do we compare with respect to what, having a 37% increase and what's happening in the industry in general? So that if you could help us put it back in perspective.
Sure. So now we get more into, there's damn lies in statistics. So historically, the county has outperformed expectations both regionally against your peers here in El Paso County, as well as nationally. And you could see some of those same numbers in the reports that Aetna was generating and reviewed with you. And of course, they were zipping through it rather quickly, but a lot of times, and every claims administrator does the same thing, they have what their book of business average or peer average is, and you can see in a lot of different categories that you're still below the book of business average in Aetna's case, or their peer average. So historically, you've been way below, and now I would say in statistical jargon, you're gravitating towards the mean. So, it all's fine and dandy to look at that report and say, yeah, we're better than the book of business. But then when the day comes that we move towards the mean, it's a big percentage change, and that's what's basically happening. So, and even in the Aetna data, there were a lot of times where they said like overall claims this year versus last year are down 1%. And so then the question is, well, if it's going down, why is our funding going up? And the reason is, again, when we look back at where the decisions were leading into 2020 and expectations we had for the future, those didn't all materialize, such as the creation of the Mexican network, where we anticipated that because for anyone that traveled to Mexico for healthcare was going to save about 50 cents on the dollar compared to the same service received in Texas. So those things didn't happen. So the claim side has been steady, and it's a little different too inside there in terms of, so for example, this week there's a $900,000 claim. Aetna's going to pay $600,000 of that. You're going to pay $300,000. So in the prior years, there were you had some claims that exceeded over $1 million. So we're seeing a growth in kind of that middle range, not the people that are passing the $300,000 mark, but more people are moving it closer to it. So it's really more of a revenue side of the equation. And the other challenge that we've had too is if you look back 3 or 4 years, your reserve fund had way more money in it that it needed to have, and that's an inefficient form of budgeting. So we went through a couple of years where we knew the fund balance would decrease, but we were hoping to get it back down to a reasonable level so that your general fund would benefit from the redirection of those monies. But what happened is you passed the mark and you just kept on going as it went down. So it went down faster than was anticipated due to a lot of factors. So most employers are not perceiving 37% increases. And again, a large part of the majority of that is to reestablish your fund balance. So it's just I'd say it's a tumultuous time to get revenues and expenses back in line. And I would applaud again the county. You have. I wasn't able to look at all of the Aetna discussions, but I've sat through the presentation a few times prior to today. There was, for example, I think there was a page in the pharmacy portion where it showed all the different tricks of the trade that they had to help minimize costs. And the only ones that you're not participating in are the 2 that they introduced this year. So the county and your HR department, risk pool board are doing a good job of recognizing things and implementing strategies to try to contain it. It's just we're approaching the mean a lot faster than anticipated, and that's what's driving the need for change.
Thank you. That's really helpful. Thank you for putting it in that perspective. Thank you. Melissa or Betsy, you want to wrap up and see what?
I think regarding this portion, the action, we were seeking action only on one item as part of this presentation, and the action is regarding the ACO network. I understand you all have your concerns. If the court was interested in adopting that ACO network, we would ask for action today so that we could start working on developing the tiers and getting it ready so that the plan and the option is ready for the October 1 open enrollment date. Berenice or Sam, chime in if I missed anything on that.
Sam, do you want to go ahead?
Yes, sir. Thank you, Melissa. So a couple things as far as action items that we're concerned about as far as timing. Couple things that we're looking at. If the court wants to go with an ACO network, there's an implementation time period that's going to be involved here so that we have enough time to be able to get the systems included in the open enrollment for October, get out the marketing, set up the systems, set up the providers for those 2 additional. So one of the things we'd be looking at is the court interested in going with an ACO network? We provided the two different plans. One that's traditional that we've been offering in the past with just a rate increase. And like Randy said, that rate increase can be adjusted. We can go with a 37% all across the board, or that can be reduced all the way down to, for instance, like 10%. But that just means there's going to need to be a higher contribution on the county side. And so anywhere in between there, we can make those adjustments. The savings I heard Commissioner Holguin talk about with the premium increases and the incentives, and I believe Commissioner Stout also mentioned that. That is a very important comment, something that we talked about internally as well. If you remember, though, the savings on the UMC is on the claim side because the county pays 95% of those costs. That's that 95-5 plan. It's not in the premium side, it's on the claim side. So even if somebody went to an ACO network and they had medical treatment and they got the same medical treatment at UMC, the overall cost for the employee is going to be less at UMC, even though you see the premiums difference. That's where the savings would be. So some of the things that we're looking for today is the court interested in going from $600 down to $300? And last year we had told the court that we would bring this back at the $300 level if our fund continued to decrease. And our fund did decrease this year to the point we had to ask for an infusion. So that's why we brought it up. However, we still agree with how Commissioner Stout is looking at this situation where the more people that are in that plan, it's a savings all the way around for the county and for employees. So the $600 level, we also kept a slide in there to show what the rates would be if we kept the incentive at $600. So we're prepared for that if the court wants to go that direction. So what we're looking for is, do we want to go with the narrow network and start setting it up and then come back with the court with the final rates based on their discussion today? If we want to go with the $600 or $300 level, and then if the court is looking toward incentivizing, contributing more so we can reduce those rates down for the individual employees. And then we can set that up and start preparing for open enrollment and marketing.
Commissioners, thoughts, comments?
Judge?
Yes, Betsy, go ahead, Betsy.
I know this is a lot of information, and I would ask that if the court would like if it'd be possible, Sam, if we waited and put this back on for the first Monday, not this coming Monday, but the next Monday meeting for the court to have some time to consider this, because it is a significant budget impact and it is a significant decision to be providing this direction. And once you provide the direction, I mean, it is generally a commitment. It's very difficult to change once you provide that direction. And since this is the first time the court's had an opportunity to, I know I had previously talked to you all about the narrow networks, but I know this would give you a little bit of chance to think over this information that's been provided and then come back, ask any questions. HR can reach out. We can answer any questions you have individually between now and that Monday.
Thank you. Go ahead, Commissioner Stout.
Thanks, Judge. Betsy, has there been an effort to talk to UMC about giving the same discounts that we would get if the ACO with tenant?
I do not believe Aetna has had that conversation with UMC. Aetna has a larger, I think on a larger scale relationship with tenant. They have done it there, but they have not done it that I'm aware of with UMC.
I think that might, I don't know if that's something that the rest of the court thinks it would be a good idea, but I think it would be a good idea. And again, I think I guess we're going to vote at a later date, but I'm definitely for sticking at the $600. Seeing if we can reduce the premium for our employees at some level, because almost 40% is just a huge hit, and if we can use ARPA money for that, if we can use I don't know if probably don't have any CARES Act money left, but reserves, right? I don't know. That's what we could look at too. And then I definitely am all for what Betsy was suggesting and using time off to incentivize. That way it's not a budgetary impact, but using time off to incentivize what Commissioner Holguin was talking about earlier and getting membership involvement. I think we should definitely do something like that.
Thank you, Commissioner. And I agree. I think there's too much information. I think we'll all reach out individually to try to make sense of everything. And it's too big of a decision without some elements. Even the UMC that was brought up, to see what happens there as well. So,
and Judge, if I could just make one more comment. Sure. I don't think it's enough to have member education right before open enrollment. I mean, I think that's something that has to be happening consistently throughout the year. I go back to, folks not knowing. I think it was Melissa that made the comment that even folks in HR don't understand why going to the standalone emergency rooms isn't a good thing. So I just feel like we have to do a better job in educating and engaging our members. Because ultimately, long term, that's what's going to have the most benefit for us and help us keep these costs down.
Agree. And I think Melissa expressed that they're going to do everything possible to incorporate our feedback and move forward. I just have a lot of confidence that once they know what we need, they'll do things accordingly. So, Betsy, you want to go ahead and?
Yes, sir. On the communication piece, I have asked Melissa and her team to please prepare the type of communication plan that we've been requesting and to bring that back and present to the court, like what all that plan would entail, so that it's very intentional and more engaging. There's no one our employees actually trust more than us. And when it comes to their benefits, when you speak to Aetna, it reminds me of somebody like yo-yoing in, and not any offense to Aetna. This is true for any representative from an outside TPA, but we need to speak to employees at a level that they understand and that they trust, and we need to do it constantly and in a way that they can understand. And so they're going to work on a plan to do that. We'll bring that back and present it to the court sometime as we're preparing leading into budget. But also, we could place this item on for the June meeting for final decision and let the court have any other opportunities to reach out and speak to HR, and HR to reach out to confirm if there's any other questions members of the court have.
Do you think it's possible more of a special session? Because, just sort of going back to how we sort of work on this versus we have 20 items on the agenda.
Yes, sir. I did. Well, just recently, we organized a special session for June 3rd. However, I know, Judge, your schedule is extremely tight that day. So I don't know if there's anything that you'd be able to move. We could extend the time or start that meeting earlier, if that would be helpful.
Whatever it takes. And I know our court here is very supportive of trying to look at it in the best possible way. This is a big, huge decision that will impact going forward quite a bit. So very important.
Just for context, the cost that we're talking about, the impact to the general fund is about the equivalent of almost 1.5 to 2 cents of tax.
Mm-hmm. That's a big hit. Thank you.
So Judge Betsy, I think
go ahead,
you're wanting us to prepare for the next June, the June Thursday presentation. We can do it at that time.
Betsy, correct me if I'm wrong. We're still coming back on June 7th, the Monday, for action regarding the ACO and the deductibles.
I'm saying if you all wanted to get it done a little sooner, and the judge is saying we would have more time if we did it at the special meeting on June 3rd.
Perfect. Okay.
Mm-hmm.
Thank you.
We will prepare for that. And Judge, Commissioners, we really appreciate the comments, and that helps us when we're designing the plan. I do want to let you know that our team has been very proactive in the communication over this last year. We've done more than that's ever been done in the county so far. But that engagement piece we know is huge here. And so we want to make sure that we advance. We feel like we're the trailblazers right now. Everybody is contacting us on what we're doing on our strategic plan. And so we're going to keep moving that forward. But thank you for the comments, and we will work on some additional plans to address those costs. In the meantime, we'll provide some additional options for you on the next meeting.
Thank you so much. Well, I know that when we say we're going to lunch, most of us actually have commitments right at 12. So, Jessica, would you take it back, and we'll take a recess at this time.
Yes, there will be no action for item number 4. Would you like to recess for 1 hour, Judge?
Yes, please.
Okay, Commissioners Court will recess for 1 hour. We will return at 1:02 p.m.
Most of us have pets, and we know that we have to take care of them and give them a home with love. But when our resources are not enough, we need to find out a better life for them. Fortunately, here in El Paso, the Animal Welfare Department is here to help. Every morning, the officers of the El Paso County Animal Welfare Department get into their trucks and set off for different parts of the county to help citizens with their pets.
My main job is to protect, capture, and care for animals, educate the community. We do everything from our trucks. We do foster transportations. We do adoptions. We do microchipping.
El Paso County is one of the largest counties in the state of Texas, and its Animal Welfare Department has only 8 officers to cover all the land outside the city.
The county is very big in terrain. It's bigger than the city, actually, but the houses are kind of sporadic. It's a lot of terrain to cover.
Today's mission is to collect some puppies and a little pig on the outskirts of the county.
Es un bebito, ¿verdad?
From a man who no longer has enough resources to support them. In 2020, the Animal Welfare Department rescued a total of 1,769 animals, of which 231 were returned to their owners and 418 were adopted. After giving the men information about the spayed and neutered services, Heriberto takes the puppies and the little pig to a shelter on the other side of the county, where they will find a family for them.
The name of the rescue here is Almost Home, and it's a big foster affiliate of ours. They help us a lot with our transition, so these dogs don't set foot at the shelter, at the animal services.
After leaving the animals in good hands, Heriberto drives away to a new mission.
El Paso goes by many names. Sun City, 915. We are known for history, culture, food, and art. In the early 1900s, development and commerce in El Paso revolved around mining and trade. The nationally recognized mission trails are just one example of the many historic sites that portray our region's rich indigenous and colonial history. Since then, El Paso has evolved, and so has its people. We take great pride in nourishing a skilled and capable workforce, with 72% of our population being bilingual. We stay competitive among other large U.S. cities. The region's border location boasts a major trade port. It allows competitive local manufacturers to produce at maximum capacity. Fleet systems are capable of worldwide distribution of parts and products. Our state-of-the-art higher education systems are nationally recognized. The Texas Tech University Health Sciences Center El Paso, the nation's first comprehensive health sciences institution on the U.S.-Mexico border, provides students the opportunities to become doctors, nurses, and researchers. The University of Texas at El Paso offers 74 bachelor's, 74 master's, and 22 doctoral programs. Local government agencies and other economic development organizations help industries become established and expand in our community. The County of El Paso is great for business, but we also keep true to our southern hospitality with plenty of outdoor recreation options. It's easy to keep active in El Paso. We are constantly looking for new industries interested in expansion. We want to offer our help and support in the process. No matter the name, El Paso is proud, strong, progressive, We are El Paso. Come see what we can do together.
Most of us have pets, and we know that we have to take care of them and give them a home with love. But when our resources are not enough, we need to find out a better life for them. Fortunately, here in El Paso, the Animal Welfare Department is here to help. Every morning, the officers of the El Paso County Animal Welfare Department get into their trucks and set off for different parts of the county to help citizens with their pets.
My main job is to protect, capture, and care for animals, educate the community. We do everything from our trucks. We do foster transportations. We do adoptions. We do microchipping.
El Paso County is one of the largest counties in the state of Texas, and its Animal Welfare Department has only 8 officers to cover all the land outside the city.
The county is very big in terrain. It's bigger than the city, actually, but the houses are kind of sporadic. It's a lot of terrain to cover.
Today's mission is to collect some puppies and a little pig on the outskirts of the county.
Es un bebito, ¿verdad?
Tiene un mes, 2 semanas.
From a man who no longer has enough resources to support them. In 2020, the Animal Welfare Department rescued a total of 1,769 animals, of which 231 were returned to their owners and 418 were adopted. After giving the men information about the spayed and neutered services, Heriberto takes the puppies and the little pig to a shelter on the other side of the county, where they will find a family for them.
The name of the rescue here is Almost Home, and it's a big foster affiliate of ours. They help us a lot with our transition, so these dogs don't set foot at the shelter, at the animal services.
After leaving the animals in good hands, Heriberto drives away to a new mission.
El Paso goes by many names. Sun City, 915. We are known for history, culture, food, and art. In the early 1900s, development and commerce in El Paso revolved around mining and trade. The nationally recognized mission trails are just one example of the many historic sites that portray our region's rich indigenous and colonial history. Since then, El Paso has evolved, and so has its people. We take great pride in nourishing a skilled and capable workforce, with 72% of our population being bilingual. We stay competitive among other large U.S. cities. The region's border location boasts a major trade port. It allows competitive local manufacturers to produce at maximum capacity. Fleet systems are capable of worldwide distribution of parts and products. Our state-of-the-art higher education systems are nationally recognized. The Texas Tech University Health Sciences Center El Paso, the nation's first comprehensive health sciences institution on the U.S.-Mexico border, provides students the opportunities to become doctors, nurses, and researchers. The University of Texas at El Paso offers 74 bachelor's, 74 master's, and 22 doctoral programs. Local government agencies and other economic development organizations help industries become established and expand in our community. The County of El Paso is great for business, but we also keep true to our southern hospitality with plenty of outdoor recreation options. It's easy to keep active in El Paso. We are constantly looking for new industries interested in expansion. We want to offer our help and support in the process. No matter the name, El Paso is proud, strong, progressive, We are El Paso. Come see what we can do together.
Most of us have pets, and we know that we have to take care of them and give them a home with love. But when our resources are not enough, we need to find out a better life for them. Fortunately, here in El Paso, the Animal Welfare Department is here to help. Every morning, the officers of the El Paso County Animal Welfare Department get into their trucks and set off for different parts of the county to help citizens with their pets.
My main job is to protect, capture, and care for animals, educate the community. We do everything from our trucks. We do foster transportations. We do adoptions. We do microchipping.
El Paso County is one of the largest counties in the state of Texas, and its Animal Welfare Department has only 8 officers to cover all the land outside the city.
The county is very big in terrain. It's bigger than the city, actually, but the houses are kind of sporadic. It's a lot of terrain to cover.
Today's mission is to collect some puppies and a little pig on the outskirts of the county.
Es un bebito, ¿verdad?
Está más big, tiene un mes, 2 semanas.
From a man who no longer has enough resources to support them. In 2020, the Animal Welfare Department rescued a total of 1,769 animals, of which 231 were returned to their owners and 418 were adopted. After giving the men information about the spayed and neutered services, Heriberto takes the puppies and the little pig to a shelter on the other side of the county, where they will find a family for them.
The name of the rescue here is Almost Home, and it's a big foster affiliate of ours. They help us a lot with our transition, so these dogs don't set foot at the shelter, at the animal services.
After leaving the animals in good hands, Heriberto drives away to a new mission.
El Paso goes by many names. Sun City, 915. We are known for history, culture, food, and art. In the early 1900s, development and commerce in El Paso revolved around mining and trade. The nationally recognized mission trails are just one example of the many historic sites that portray our region's rich indigenous and colonial history. Since then, El Paso has evolved, and so has its people. We take great pride in nourishing a skilled and capable workforce, with 72% of our population being bilingual. We stay competitive among other large U.S. cities. The region's border location boasts a major trade port. It allows competitive local manufacturers to produce at maximum capacity. Fleet systems are capable of worldwide distribution of parts and products. Our state-of-the-art higher education systems are nationally recognized. The Texas Tech University Health Sciences Center El Paso, the nation's first comprehensive health sciences institution on the U.S.-Mexico border, provides students the opportunities to become doctors, nurses, and researchers. The University of Texas at El Paso offers 74 bachelor's, 74 master's, and 22 doctoral programs. Local government agencies and other economic development organizations help industries become established and expand in our community. The County of El Paso is great for business, but we also keep true to our southern hospitality with plenty of outdoor recreation options. It's easy to keep active in El Paso. We are constantly looking for new industries interested in expansion. We want to offer our help and support in the process. No matter the name, El Paso is proud, strong, progressive, We are El Paso. Come see what we can do together.
Go ahead.
Commissioners Court has reconvened into special open session. Judge, we have some guests here for item number 7 we'd like to take up first. Item number 7, receive a presentation from the United Way of El Paso County regarding its efforts through the Family Resiliency Center and the newly established Community Resiliency Center and services available to the community.
Thank you. Who do we have as our guest?
Hello, Judge. This is Christina Lamore with
Christine.
United Way.
Excellent.
Good to
Thank
see you again.
Thank you.
Good afternoon, Commissioners. Do we have the PowerPoint presentation? Wonderful. Thank you so much. So thank you again for allowing us this opportunity to provide a short update on our El Paso United efforts. About a year and a half ago, we established the Family Resiliency Center, and most recently, we established the Community Resiliency Center, and we'll go into a little bit more detail about what those are and why they're important to the county and to your constituents. Next slide, please. So my name is Christina Lamore. I'm the Vice President of Community Impact with your local United Way. With me here today, I have Mariana Sierra, our Outreach Coordinator for the Family Resiliency Center. And if you want to forward the slides, please. Angelica will present at another time. Next, please. Mariana Sierra will talk about our Family Resiliency Center. And on the next slide, you will see Jorge Camargo, our Outreach Coordinator for the Community Resiliency Center. So if you go into the next slide, I'll just give you a little bit of background on the United Way here in El Paso. We are fortunate enough to be affiliated with national, state, and international United Way organizations. But the benefit of having a local United Way is that we can make decisions that are pertinent and that are valuable to El Paso residents. Most of our work focuses on the areas of education, health, basic needs, and financial stability. And we have a local governing board here in El Paso that decides how our funds and our services are used to best support the individuals in El Paso County. Next, please. Awesome. So as part of the basic needs impact area that we work in, one of the major strategies that we focus on, especially over the last couple of years, is disaster response. So this could be a myriad of things. On an ongoing basis, we have a very strong relationship with the City and County Office of Emergency Management. We facilitate the Emergency Food and Shelter Program using FEMA dollars to provide emergency housing and emergency food. We are also engaged in the volunteer organizations Active in Disaster, which is a local organization of lots of different nonprofits responding to disasters. And over the past several years, our United Way has been called upon to assist with disaster response, most specifically in 2019 with the migrant services surge. Of course, after our August 3rd tragedy in terms of the long-term recovery. And then, of course, most recently with COVID-19 relief and response. And personally, I actually serve as the Human Services Officer for the Office of Emergency Management in our COVID relief response. And what that means is I act as a liaison between the nonprofit social service organizations and our local government effort. And I'm very proud to take on that role. Next, please. So to give you a little background, the El Paso United initiative takes place in two parts. The first of which is the Family Resiliency Center, serving individuals impacted by August 3rd. And the second is the Community Resiliency Center. That was just established a couple months ago, actually, to serve individuals affected by COVID-19. So the big commonality between those two is that they provide the same main service. And what that is resource navigation. And on the next slide, I'll tell you a little bit more about that. So resource navigation, we kind of made up our own definition. It is the act of meeting with clients, assessing their needs, setting goals with those clients, and then helping them to find different resources that are available to them within the community. One thing that we have learned working more than 98 years in the El Paso community is that there's a lot of services available, but sometimes our residents don't always know how to access them. And so that's what resource navigation is really about. It's about helping clients to identify what needs they have, what services they may be eligible, and then trying to break down some of the barriers to accessing those services. Next, please. So what our navigation looks like when somebody shows interest in either our Family Resiliency Center or Community Resiliency Center, we conduct a short intake just to learn a little bit more about the client, make sure that they meet our eligibility requirements, identify any needs that they have, set goals, and then from there, based on the information that we capture, we're able to access a pretty comprehensive resource directory and make referrals out to direct services within the community that may be able to meet their needs. After that's done, we always make sure to follow up multiple times with the client, with the participant, and also with the service provider to make sure that the referrals that we provided were beneficial, to assess any additional needs that may have arisen, and make sure that we're meeting all the goals that that client has set for themselves. If we identify that a goal has not been met, or if we need to meet a new need, then we start that process all over again. If we identify that the goals are met and they're ready to exit the program, we allow them to do so. Of course, always understanding that our doors are open if at any time they need additional assistance. Next, please. Unfortunately, because both our Family Resiliency Center and our Community Resiliency Center are grant funded, that means clients must meet certain eligibility requirements in order to participate. So sometimes we do get inquiries from individuals who, unfortunately, we cannot serve as comprehensively as we would like. When that happens, we don't conduct an intake. That individual is not necessarily paired up with the resiliency navigator, but we do our best to provide general resources within the community that may be able to assist that individual. Next, please. So that gives you a brief rundown of the main services offered through El Paso United. And now I'll turn it over to Mariana Sierra to tell us a little bit more about the Family Resiliency Center.
Awesome. Thank you, Christina. Hello, everyone. My name is Mariana Sierra, and as Christina said, I'm the Outreach Coordinator for the Family Resiliency Center. And today I'm going to talk to you about what is it that we do and a little bit about our milestones since our opening. So the Family Resiliency Center is a place of healing and support for anyone that was impacted directly or indirectly by the tragedy of August 3rd. So we do see ourselves as a referral hub for the community, and we're committed to helping anyone in the community navigate through the different services that are offered. Next slide, please. So who do we serve? So we serve any individual that was impacted directly or indirectly, and this includes, children, seniors, families, couples, I would like to highlight this. A lot of people are under the impression that they had to be at location, meaning Walmart or Cielo Vista, in order to be eligible for our services, but that's not entirely true. We serve anyone in the community that might be triggered by August 3rd. So just to give you all an example, say that, you might be feeling a little bit more anxious going to a store doing your groceries. You would be eligible for our services. Now that we're getting close to the 2-year mark, of August 3rd, and emotions are revoked, you would be eligible for our services. So the FRC is open to any member of the El Paso community who may feel the need to participate in our healing activities and receive our services. Next slide, please. So as Christina mentioned, our main service is navigation and referrals. That's the heart and soul of our Resiliency Center. However, we do provide other services such as mental health services, thanks to wonderful partnerships that we have with local community organizations. We also have non-traditional therapies and programming, support groups, and outreach and education. Next slide, please. So here's a little graphic of, some of our milestones, our current active cases. So currently we have 143 active cases with a total of 592 referrals. So those referrals are under basic needs, legal assistance, non-traditional therapies, mental health, and other items. However, our the work that the FRC does and that our navigator does goes beyond these numbers. And here I would like to provide a testimonial of one of our participants. So if you click the next slide, please, so we can listen in. Oh.
Just a second, please.
Thank you.
Walking into the FRC, I was so overwhelmed and devastated. I was now caregiver to my mother and grandmother and trying to figure out how to help my oldest daughter. I heard about the FRC on the news and decided to go speak with them. I met Jamie that first day. I was so overwhelmed with everything I need to do for my mom and daughter and had no clue where to even start. So many phone calls, so much paperwork, and at the time, I was still dealing with my dad's estate and everything that needed to be done after his passing. I was barely hanging on. But when Jamie started talking and pulling out forms, writing notes on everything I needed, and reassuring me for the first time in months, I felt like I could breathe again. This past year, she was always this constant reassurance, asking how we were, if we needed anything, what she could do to help, offering services and programs. She cared. She has helped us in so many different ways, more than she can even know. Just her presence and kindness brought this peace in the middle of the chaos of this past year, a lifeline I didn't know we needed. Thank you, Jamie and FRC, for the continued help and support to not only my family, but to our community.
Thank you. So that is just one example of our participants, the people that come through our FRC, and we are very, very honored to be able to provide these services. And really, our navigators are very, very committed to make things easier for our community members that, are looking out for this service, for this guidance and support. So now moving forward to counseling and mental health. As I said in the beginning, we are able to provide this service thanks to wonderful partnerships that we have with local community organizations, including the Community Recovery Center by Emergence Health Network. So they are the ones who provide the direct counseling, the direct mental health assistance, as well as other individuals such as El Paso Child Guidance and Family Service and other organizations that I will highlight later on. Next slide, please. So now we have non-traditional therapies and programming. When we were starting our FRC, we recognized that there was a stigma surrounding mental health. Therefore, we wanted to provide as many options as we could in order to provide this assistance to our community members, because the FRC understands that non-traditional therapies can supplement and support traditional and psychological therapy. Therefore, the FRC hosts a variety of events and programming, that allow for this recovery process for our community members. Next slide, please. So these are our wonderful contractors, our community partners. So as you can see here from the screen, these are all the organizations that, provide this non-traditional therapy. We have mental health therapy, and those are the organizations that provide this. We also have what we call the body-based movement therapy. So it's anything that's related to body movement, such as yoga practices. And finally, we have the very, very well-received creative therapy. So anything creative that allows an individual to, process their emotions and seek for a well-being. Next slide, please. Now, outreach and education. As part of our long-term goals, the FRC is also focused on increasing the understanding of mental health by providing education on the signs of trauma-induced stress. And we do this through many ways. One of them being, of course, social media and graphics. We'd like to provide as much education as we can using our social media platform and our presence in the social media world. Next slide, please. And we also created a podcast, United and Resilient. And through this podcast, we try to reach the wider community, right? So we highlight conversations with local leaders, mental health specialists, and fellow El Pasoans that can share their expertise and guidance. I know the judge was one of our guests last year. So we have wonderful, wonderful guests in our podcast. And the most recent episode, we talked about anxiety, what it is, and how you can cope with it. So this is how we also provide this education and support for our community. Next slide, please. We also do mental health care kits. So for the month of May, actually this month, we join national efforts to raise awareness on mental health. And we do this by assembling mental health care kits. And last year and this year together, our team assembled 243 mental health care kits. And in these kits, they include, activities, education for both children, families, individuals, and it's very, very, very well received. Our participants are always very thankful that whenever they receive these kits, and they're wonderful because, like I said, we make them thinking about the family, individuals, children, and definitely helps boost mental health. Next slide, please. So, of course, because we are the Family Resiliency Center, we take the lead in what is the remembrance events, the remembrance efforts for August 3rd. So in 2020, the FRC took the lead in the Love for El Paso efforts that promoted healing and resiliency for El Pasoans. We aim to honor those we lost and send love to those that were impacted. So we did this by doing a couple of things, one of them being the Luminaria Remembrance Drive-Thru, and roughly we received around 3,000 cards in Escarate Park. And then we also hosted a youth art competition where, our youth and our children were able to express their emotions and their love for El Paso through art. And then we also had a yoga session via Facebook, and finally a trauma reporting panel for all of our media personnel. Next slide, please. So now for this year, as many of you may know, the El Paso County approved a resolution declaring July 3rd to August 3rd as a month of unity and healing. So the FRC will again join those forces with the county to provide memorial events for the community. And we will do this by taking the lead again, doing the second time Luminaria event as well in Escarate Park. And we will also highlight our community partners through different events that they will be doing. In addition to this, we will be responsible in creating the Love for El Paso website, where all activities of remembrance are going to be highlighted. Next slide, please. So how can you help? Well, we understand at the FRC, like I said in the beginning, August 3rd was something that impacted our community as a whole. So if you come across anyone, family members, friends, co-workers, or yourself that were impacted directly or indirectly by August 3rd, please refer them to our FRC. Our navigators are all wonderful, and they're eager to help as many community members. Due to the pandemic, our offices are closed, but we do provide all of our services virtually, and we accommodate accordingly. So that's it for me. I'll leave you with my colleague, Jorge Camargo.
You're muted, Jorge. You're muted, Jorge. It's still showing you as muted.
Jorge, would you like me to try?
Yes.
Oh, we hear you now. Okay. We hear you
Oh,
now.
perfect. Finally. Had some glitches on muting myself, but thank you, Mariana. Good afternoon, everyone. My name is Jorge Camargo, and as Mariana mentioned, I am the Outreach Coordinator for the Community Resiliency Center. I want to thank you for the opportunity and time to talk to you about the services we are providing to our community. As we all are aware, El Paso has been highly affected by the pandemic. Thankfully, our local governments have invested in COVID-19 relief resources, such as rental and utility assistance. However, these funds are set to expire sometime soon. And they were also available last summer and fall. But our community saw some reluctance on appliance, probably due to challenges in technology, misinformation, or just a confusing process overall. And with funds being available again, but set to expire too, one of the goals of the CRC is to facilitate the connection to these community resources in order to help El Pasoans find a better sense of financial stability. Next slide, please. Our United Way has established the Community Resiliency Center as a response to the pandemic. It is the goal of the CRC to provide navigation services to El Pasoans that have been financially impacted by COVID-19. Our highly trained navigators help individuals and families access the resources available in our community in order to address their financial needs. Next slide, please. The CRC is able to assist renters within the El Paso area who have been financially impacted by COVID. They must prove some sort of financial hardship, like a resignation letter or an employment letter. Their income must not exceed 80% of the household median income, and finally, they cannot be receiving duplicated services from any other agency providing COVID relief support. Next slide, please. The CRC strives thanks to our community partners and the services they are providing to El Paso. Our current collaborators include Paso del Norte Community Foundation that offers rental assistance through their EP Rent Help program, Project Amistad assisting with utility, counseling, and transportation, and Project Bravo offering utility assistance as well. In order to provide better assistance to individuals and families that may reach out to the CRC, our navigators are very familiar with the operation of our partners. They know all the ins and outs, such as the application process, eligibility requirements, and such. Next slide, please. Even though COVID-19 relief resources are available without the CRC's assistance, our navigators provide personalized case management that makes clients eligible for future assistance within the CRC that will further address their long-term financial needs. If an individual or family is eligible to receive the CRC services, they will also benefit from assistance on mental health, food security, and job skill building programs. Next slide, please. Our numbers since the CRC's launch last month indicate that we currently have a 34% of acceptance rate within 134 applicants. Our navigators also made 26 referrals to rental or utility assistance, taking up more than half of our referrals in total. As you can see here, they also made some referrals to mental health and job skill building programs. And as Christina mentioned, if a client is not eligible to receive services from the CRC, they receive a courtesy referral to any other services that may apply to their own personal needs. Next slide, please. And even though the CRC mostly functions as a virtual center, our navigators are able to assist individuals in person at the Stanton COVID-19 clinic on Monday, Wednesday, and Friday from 9 a.m. to 3 p.m. And we will also have a navigator placed at the El Paso Electric Payment Center on the first week of June. Next slide, please. Here's the contact information for both the FRC and the CRC, and I will lead to Christina now.
Thank you, Jorge and Mariana, for sharing those details about the programs. I think one thing that I'd love to point out is that both the Family Resiliency Center and a portion of our Community Resiliency Center are funded by El Paso County. So thank you very much for that support. We are proud to serve your constituents. We are proud to be able to provide this service to those that are in need of it. And we are a proud partner of the county. The one thing that we do ask is that you help us spread the word, and that if you have any presentations coming up with your communities, with your constituents, where we can get the word out about the services that are available, we would love to join. So with that, that concludes our presentation. If there's any questions, we're happy to answer.
Christina, thank you. Jorge, Mariana, thank you so much. Yesterday we did a valiant, act trying to get that word out. We have that press conference there at the Stanton Center. I think thank you for organizing that. But it's almost hard to believe that we got some funds and they're not being tapped on, and that's sort of sad because we know there's a tremendous amount of need out there. So I think if with the precincts, I mean each one of your areas, if you did anything and when you're having your discussions with your constituents, I think this would be great. I think it's a great program. You've done a great job on reaching out, but I think we just need one more push to be able to get the word out there. But really thank you for everything that you're doing in respect to these individuals that have gotten the impact of COVID and struggling out there. So we got to help our community. Commissioner Stout, go ahead.
Thanks, Judge. I just wanted to make a couple of comments. I thought I was gonna introduce the presentation, but I just wanted to say that I know that we've been a lot through the last 22 months, and I'm very proud of the efforts that the FRC and now the CRC has put into place to respond to the needs of the community. And as you all know, that the Walmart and the Cielo Vista are in the precinct I represent, as well as the Youth Services Center where the FRC is located. And I'm very proud to have been approached by the United Way to be part of their steering committee and work, or their advisory committee, and work with them. And it just has been a great pleasure for me and my staff to work with so many talented and passionate and compassionate folks. I'm really thankful that the United Way took the model of the FRC and brought it over to the CRC. And I really hope that we can have further outreach and a more deep impact on folks. Thank you all. Thank you and the Mayor, Judge, for bringing light to that in your press conference. And just wanted to say what an amazing effort that you all have been doing, and I'm honored to see you here today and to be part of it. Thank you.
You're muted,
Judge. I think you're muted. I can't hear you.
This problem that it mutes by itself. So anyway, I just want to thank you also, Commissioner, for staying close to this throughout the beginning to the end now and trying to get into this new program. So thank you for your participation and your promotion. Thank you.
And thank you again for all of your support. I apologize, Commissioner Stout. I was so excited to present that I kind of cut your introduction off. But thank you for allowing us the opportunity to be here today.
Well, thank you. Go ahead, Jessica. We'll go back thank you and have a great afternoon, all three of you. Thank you.
Okay, back to the regular order of the agenda. Item number 5. Receive an update from County Commissioner Carl Robinson regarding the purchasing board.
Jessica, I apologize. I should have told you earlier that we've got individuals waiting. So Betsy, we need to go to which item, please?
TCDRS, Judge, item number 9. We have guest from TCDRS on the line.
Okay,
I'm sorry,
item
Jessica,
number 9.
I didn't mean to interrupt you. Thank you.
Thank you. Item number 9, receive a presentation regarding TCDRS benefits for year 2022 and provide direction to staff as necessary.
Good afternoon, Judge and Commissioners. Wally Hargrove from Budget and Fiscal Policy. Similar to the report you received this morning from Human Resources on our benefits regarding our health and life accounts, today's presentation will be given by Ms. Roxanne Aldrich. She's a representative from our Texas County and District Retirement System, and will provide you with an update on the rates and plan for fiscal year 22 or calendar year 22, which is coming up in fiscal year 22. With that, I'd like to introduce Ms. Roxanne Aldrich.
Thank you, Wally.
Hi, Roxanne. Welcome.
Hello. Thank you for having me here today. I will not be taking as long of a time as the morning presentation, rest assured. So we're going to go through this presentation. I know you have seen most of this last year and in previous years. Please let me know if you have any questions as we go through the presentation. Next, thank you. So just to recap where we are as far as our numbers, we have over 800 counties and districts that participate with TCDRS, and that's over 330,000 members and retirees. Our at 8.5% 35-year return and 87% funded, we are in the top of the nation plans as far as funded ratio is concerned. And also, as far as $36 billion in assets, we're one of the largest top 50 retirement systems in the nation. Next slide, please. TCDRS was created in 1967 by Texas legislature. We do not receive funds from the state of Texas. The money that comes into TCDRS comes in from employee contributions, employer funding, and investment return. On average, our operating costs are 0.23% of our assets, and we're managed independently by a 9-member board of trustees who are appointed by the Texas governor with the approval of the Texas Senate. There are 3 main features that set TCDRS apart from other retirement systems, not just in the state of Texas, but nationwide. And that is, we are a savings-based benefit. Both your employees and you as an employer are saving in advance, so these benefits have been paid for, have been provided for at the point of retirement. We have responsible plan funding, and that means every single year you get document from us, the plan assessment, which will give you your cost for the following year if benefits remain the same. We do that. We look at your plan every single year to make sure you don't overpay or underpay for the benefits you've promised your employees. You have flexibility and local control. You can take a look at those benefits. You can take a look at your cost. And if you need to adjust your benefits to control cost or to enhance your plan, you have that option on an annual basis. So going back to the savings-based benefit feature, as I mentioned, employees and the employer are saving in advance, so the benefits have been provided for. 7% of all of your employees' paychecks before taxes are deposited into their individual account. This account earns 7% compounded interest on an annual basis. And just to let you know, the options that you have as the court for to select for your employees are 4, 5, 6, or 7. So 7% is the highest you can elect for your employees. Next slide, please. Next slide, please. So I'm going to tell you because I know what the next slide is, but your match is 250%. And so at retirement, an employee's account will receive $2.50 from the county. The range that the county has is between 100 or 1-to-1 and 250 in any number divisible by 5. I think we might be having technical difficulties.
We're currently on slide 8 on our end with employees 43 years old with 11 years of TCDRS.
Oh, I'm sorry, it's not advancing on my end.
It might be a little slow on your end. We're on slide 8.
Okay, I'm still on slide 6. So, all right, give me 1 second, please.
Betsy, are you seeing slide 8?
I'm seeing the slide that is our average employee and retiree profile.
Okay, yeah, that's where we're at.
I'm going to do something really quick. Give me 1 second. Okay. Your average employee and retiree profile, on average, your employees are age 43 and they have 11 years of TCDRS service. So what I mean by your average, I mean this is specific to El Paso County. On average, your retirees retire at the age of 58 with 20 years of service at retirement, and they have an average annual TCDRS benefit of $32,800. In 2019, we paid $1.6 billion in benefits to all of our retirees or their beneficiaries if the retiree has passed away. In El Paso County, we paid close to $53.5 million. Now, we started doing an economic impact study a few years ago, and we found that about 97% of the money that we pay to our retirees remain in the same communities where they worked, and now they're retired. So if that remains for El Paso County, or if that is true for El Paso County, then you could just imagine 97 to 98% of the $53.5 million remaining in your community. So this money, we looked to see how it trickled through and found that it supports $2.4 billion in total economic output, created over 17,000 jobs, and added $1.4 billion to the Texas gross domestic product. Here's what you currently are offering your employees. You have an employee deposit rate of 7%, and I mentioned earlier that the range you can select from are 4, 5, 6, or 7 as far as your employee deposit rate. You have a match of 250%, and that is the highest that you can select for your employees. And the range can be between 100 to 250% in any number divisible by 5. You have an 8-year vesting. The only option as far as the vesting is to lower it to a 5-year vesting. Your eligibility requirements, there are 3 in place. Whichever one your employees meet first, they're eligible to retire. So the first one is your vesting and age 60. The second one is the rule of 75. Your employees would still have to have the 8-year minimum vesting met. And then the last one is 20 years of service at any age. With the rule of 75 and 20 years of service at any age, that is the lowest available. So there are no other options as far as those 2 are concerned. Now we're going to look at this slide, what you provide at retirement, and this has your replacement ratio. So based on an employee deposit rate of 7% and a match of 250%, it's showing you what percent of someone's final salary at retirement will be replaced by their TCDRS pension, and how long they work for the county makes a difference. So if we look on the far right side, someone that's hired at 35 retires at 65. So a 30-year employee, they would get a little over 100% of their final salary replaced by their TCDRS pension, so 101%. Versus someone that is hired at 55 and retired at 65. So on the far left side, 10 years of service, they would get 25% replaced by TCDRS. We saw earlier that on average, your employees have about they have about 20 years of service at retirement. So if we look in the middle column, hired at 45, retired at 65. So on average, your retirees are replacing about 58% of their final salary when they do retire. Let's talk about plan funding. I mentioned earlier that we are not funded by the state of Texas. The money that comes into TCDRS comes in from employee deposits, employer contributions, and investment earnings. So here's the breakdown of how each dollar that we pay a retiree, where the money comes from. So for every dollar that we pay out, 11 cents comes from employee deposits, 15 cents from employer contributions, and 74 cents comes from investment earnings. So that means investment earnings plays a significant impact in our plan. We have a highly diversified portfolio, and when we are when we're designing our portfolio, we not only want to achieve a return to sustain the plan, but also we want to make sure that we're controlling risk, because we know risk directly impacts our employers. So if we have losses from investment return, it's going to mean an increase in cost for our employers, and the opposite. If we have gains, it's going to mean a positive impact. It's going to mean a decrease in cost to our employers. This is an estimated as of December 31st, 2020, and the estimated is the 2020 return. I do believe we're going to be a little over 10% when everything finalizes and it all comes in for 2020. So this shows you our 2020 return, as well as the 5, 10, 15, 35-year returns. We compare our returns to industry set benchmarks, and as you can see, we have outperformed almost every single one of them. I think the 5-year is the only one where we had 9.1%, and the benchmark was 9.2%. And then if you wanted to look at an annual return for TCDRS, so this goes all the way back to 2001, so for the last 20 years. We have the gray band in the middle, which represents our risk tolerance. So we want to stay, when we're designing that asset allocation that I mentioned earlier, we want to stay within that gray band as far as our returns are concerned. So we have performed as expected, and we have a few outliers. Of course, we have that great recession in 2008 when we have negative 29% investment return, and then the subsequent recovery the following year when we had 26.5% return. Now, how employer rates are determined. So every single year we look at your plan, we compare what we assumed was going to happen versus what actually happened, and your rate gets adjusted, the cost of your plan gets adjusted. So the technical steps is that we study your workforce, estimate the benefits you will pay down the road, and then compare your plan assets with the estimate of benefits. So plan assets versus your cost, and then we determine a rate to appropriately fund your benefits while maintaining stability. We do this on an annual basis to make sure you don't overpay or underpay for benefits that you've promised your employees. For 2022, your required rate is 18.63% of payroll. By paying this required rate, you're doing two things. You're investing for your current employees' future benefits. So that means you're saving in advance so that when your employees are retiring, the money has been provided for. And then any liabilities, any unfunded liabilities that your plan has within TCDRS, they get paid down within 20 years. And an unfunded liability is simply the difference between the cost of your plan and the assets available to pay for the cost. Now, there has been a significant change in one major assumption that just came into play. Our board just approved it a couple of months ago. And that assumption was the long-term investment return assumption of 8% that just got lowered to 7.5%. We did that not because we have not been able to achieve returns in the past. As you saw, our 35-year return was 8.5%, but because looking forward, looking in the future, we realized and we saw that the 8% was no longer feasible. So we have changed the investment return assumption to 7.5%. That resulted in an increase of cost to all of our employers, pretty much all of our employers. Some who are overfunded, they did not see any kind of impact, but majority of our employers saw an increase in their required rate. You saw earlier that our estimated 2020 return is over 9%. So we were able to use the gains from that investment return to soften the impact to our employers, so they did not see as much of a hit to the cost. So here's how your rate changes from 2021, from the current year to next year. This assumes you keep your plan the same, that you make no changes to your level of benefits. So currently your cost is 18.01%. We don't know if you're going to make any changes to your plan. I'm going to skip to that assumptions and methods line. So this is the impact that changing the investment return assumption to 7.5% had on your plan. It increased it by 0.64% of payroll. So any number in that column that's a positive number, it's actually a negative experience because it's adding to your beginning rate, versus if it's a negative experience like demographic and other changes, that's a positive experience because it's subtracting from the rate. The demographic and other changes, that's purely what happens on a local level, not something that you could really control. Either payroll went up more than we anticipated, or more people quit and withdrew their money than anticipated. More retirements happened. So that just kind of bundles in everything on the local level, either for payroll or what your employees and retirees do. And then it might result in a positive or a negative experience on an annual basis. So by adding everything and subtracting in that column, we came up with 18.63% for 2022. Your funded ratio is 83.6% funded. I'm going to remind you system-wide funded ratio is about 87% funded. So your plan is just a little below that. If you're going to ask, or if you're wondering what is a healthy funded ratio, experts recommend 80% and above as a healthy funded ratio. By paying the required rate, the 18.63% for next year, you're paying down on funded liabilities and moving closer to being 100% funded. To keep that rate stable, there are several tools available. You can maintain or you can adjust your level of benefits. And I think Wally can talk to you more about adjusting your level of benefits. And then you could contribute at a higher elected rate. So instead of paying 18.63, you could elect to pay 19%, 20%. I know that means more money, so that's not always a possibility. It's just an option that's there. There's also the option of making an additional employer contribution. So there's money at the end of the year. You can send it in as an additional contribution. It increases your assets. It lowers your unfunded liability and therefore slightly increases your funded ratio. I'm going to stop right there to see if there are any questions.
Commissioners, any questions, comments? Hearing none, go ahead, Roxanne.
Okay. Let's go to the next slide, please. So, it's finally caught up. We have our conference. It's going to be our first virtual conference. We're working very hard on it. We almost didn't have it, but we had to make the decision early in the year to keep it virtual or to not do it, not have one. So we went ahead and did a virtual one. So it's going to be interesting this year how we do it. Next year, we're going to be back live in person, but if you're able to attend, July 21st through 23rd, and we do have continuing education credits, so please save the date, and registration information is already available. Next slide, please. And I'm going to end it right there and see what questions you have. Oh, by the way, if you decide to make any changes to your plan, you have until December 15th.
Thank you, Roxanne. Much more optimistic than this morning, and you kept your promise. It's a very succinct but very good presentation. So thank you. Wally?
Thank you, Judge. Sorry for the technical difficulties.
No, that's fine. Good job. Thank you.
Thank you.
Wally?
Thank you, Judge. Just a few fiscal facts just to give the court some additional information on impacts this will have for the FY22 budget. So as noted, had it not been for some actuarial assumptions, we actually would have seen our rate come down by 0.02%. But because of those actuarial assumption changes, that 0.63% increase in our rate, we'll take that into account for our plan year starting January 1. The impact for the general fund is about $804,000, and we have taken that into account with our proposed budget for fiscal year 2022. As far as plan options and changing those plan options, because we can only have one plan, we cannot have a two-tiered plan. We currently have a contract with your collective bargaining union with the sheriffs, and have locked in, at least unless we had a reopening clause, to renegotiate our contract. But during the term of our contract, which goes through 2023, there is a one-year evergreen. Unless we open and renegotiate the terms of the retirement with the union, we have the same retirement plan options taken into account for fiscal year 22 and fiscal year 23. So unless we were to renegotiate, we have one plan we could consider. As noted, if we were to consider any other cost options, every 1%, every 1% we would choose to contribute to the plan would have about a $300,000 year cost to the County of El Paso to contribute towards that. So, so just so you know what that, every 1/4%, I apologize, every 1/4% increase in the contribution we choose to make as a lump sum actual is about a $300,000 impact. So if we chose to contribute 1 additional percent, that would be about $1.2 million additional to buy down future cost.
Comments? Any questions from our commissioners? If not, back to you, Wally. You want to wrap up?
So that concludes today's presentation. We have taken the rate into consideration, and unless the court wanted to request that we consider any additional changes to the rate, contributions to retirees, there's only 2 options. It's a COLA or a CPI. There are long-term impacts to that, or if we wanted to consider reopening the contract to consider rate negotiations. That's the only 2 options. Other than that, going into plan year 2022, 18.63 and an $800,000 impact is your cost for next year.
Judge?
Yes, Betsy.
The only other thing I do want to emphasize, what Roxanne shared about the training for TCDRS, especially if you have not attended it before, it's a really thorough overview, and it does count towards the required training. I know she mentioned this, but it is a way for us to make sure members of the court get some of their required training hours. And this year, since it's virtual, if any of you all are interested, we do, if you sign up, I think by June 20th, it is a little bit cheaper. So just so you're aware of that, it's a great way to get some of the hours that you're required to get for members of the, I know commissioners are required to get certain hours.
Excellent, thank you. Wally?
That concludes today's presentation.
Well, thank you, Wally. Appreciate everything you do to keep us informed. And Roxanne, thank you for taking time and being with us, and look forward to going into the future. So thank you. Oh, yes, I'm sorry. Commissioner Leon?
I apologize. I didn't hit the raise your hand button. Wally, I know that over the last maybe several years, we've injected an additional amount into the fund. And I can't remember what that amount is. Are we also, is it in our budget to inject the fund for 21? Was it in the budget for that?
We did not include that for 21. It's been a couple of years, and we've only done that once in the last, I want to say in the last 2 decades. We've only done that once, and we did that a couple of years ago. We did about a $500,000 injection, and that injection is already included in our annually determined rate. I have not planned an injection in the FY22 rate.
Would it make an impact on future courts, let's say 5 years from now, insofar as our unfunded percentage?
In theory, yes, assuming that all factors remain the same, and that's that little qualifier that Ms. Aldridge had on one of her slides. But it could potentially make an impact if all other factors remain the same.
It would make an impact. So, like, for example, even if there's a negative impact later on, the negative impact would have been worse had we not made that infusion. Would that be correct, Roxanne?
That is correct. And you can also play with the plan customizer, or I can do that and run it. If you have a number in mind for an additional contribution, we can easily plug it in to show how it would impact your rate next year. We can also run additional reports that show over the next 5 years in a down market or an up market situation, what your required rate is going to do. We've done that in the past as well for the county. So there are many tools that we can utilize if you wanted to plan a little bit further down the road.
Yeah, thank you. Maybe you could throw some of those numbers at us, Wally, during our budget sessions and see what sticks.
Absolutely. The nice thing is as the employer, we have access to the plan customizer. So the reports I received from the retirement system this morning, I was able to proof them online within seconds because that's a very effective tool.
Excellent. Well, Roxanne, thank you. You have a great afternoon, and so we'll continue. Thank you.
Thank you.
Thank you, Wally.
Thank you.
Go ahead, Jessica.
Okay, item number 5, receive an update from County Commissioner Carl Robinson regarding the Purchasing Board, the Rio Grande Council of Governments, West Texas Water Development Board, and Justice Leadership Council.
Go ahead, Commissioner.
Well, good afternoon, everybody.
Good afternoon.
To give you an update on it's a pleasure to serve the community, but more so to serve on these various boards that we select to serve on that we're appointed to. The first one I'm going to talk about is the Justice Leadership Council. That's the council studying the justice issues for justice reform. And those individuals on that board are Judge Linda Chu. I'll get my list here. Judge Linda Chu, your illustrious Judge San Diego, Ruben Morales, Sheriff Richard Wiles, County Attorney Joanne Burnell, District Attorney Rosales, Kelly Childress from the Public Defender's Office, and of course myself, Carl Robinson, and we got Joel Bishop and Michael Carrico. Basically, that committee or this committee serves as an entity to look at reform as far as some of the issues we have with justice and justice reform. There's been a lot of concern, a lot of criticism, both locally and nationally, in regards to the justice, and they may strive to improve the quality of justice in El Paso County. Next, we have the Purchasing Board, which is comprised of Judge Navarrete, Judge Medrano, Judge Dominguez, Judge Medrano, Judge San Diego, and yours truly, Carl Robinson. Purchasing Board, unfortunately, got bad news. We had a board meeting yesterday. Got bad news that our purchasing agent is resigning. So we're in the process of, we'll be in the process of recruiting to hire a new purchasing agent for the county. The purchasing agent, Deborah, decided to retire with her husband, and for personal reasons, it had to do with performance or anything of that nature. She voluntarily resigning, and she'll be on board for the next 6 weeks, and then she'll move on to her retirement activities as far as with her husband. The process, in coordination with the not purchasing, but human resources and Deborah and other entities, we will be looking at looking both locally and nationally, regionally as well, to find someone that will be qualified to take the job. They will serve the county for in county's best interest. Next, we have Rio Grande Council of Government. Rio Grande Council of Government serves counties of El Paso County, Jeff Davis County, Presidio, Brewster County, Husbands County. So the region is for it covers from El Paso County almost to Midland, Texas. So there's a lot of counties in that area between El Paso and Midland where we serve as far as the Rio Grande Council of Government. Now, some of the things that the COG is referred to. Oh, by the way, Commissioner Leon is one of the members of the COG as well, along with Chef Wiles. Some of the areas that are covered by the COG. Let me get the right page. Just a minute, Judge.
Sure.
Sorry about that. I lost my page. Some of the committees that the COG has is the Finance Committee, Aging Advisory Board, Council, First Responders Regional Planning Group, Criminal Justice Advisory Committee, Solid Waste Advisory Committee. Programs operated by the COG also on behalf of the entities is the Dispute Resolution Center, Far West Water Planning Group, and the Upper Planning Group. Now, in regards to the Far West Texas Water Planning Group, there's also a committee that's served on, but that committee serves as an entity to bring water in or to improve the quality of water within our region. Programs operated by the COG, Older Americans Act Program, Emergency Preparedness, Criminal Justice, Municipal Solid Waste, Emergency Communications, that's 911, Hazard Mitigation, Community Development, Economic Development, and Workforce. I try to make it as brief as possible, but that is pretty much the nutshell. The Water Planning Group, the Rio Grande Council of Government, the Justice Leadership Council, and that's pretty much it. If there's anyone got any questions. Oh, let me also note that the COG was very instrumental in the coordination and assistance in the emergency planning, as well as the immunization that we had success in so far, particularly with the 65 and over group.
Thank you, Commissioner.
So any questions that you may have?
Questions from anyone? Hearing none. Thank you, Commissioner. Appreciate that.
Thank you.
Great boards. Thank you.
Yes, sir.
Commissioner Holguin.
Thank you, Judge. Does Jessica need to read in the item before I start?
Yes, go ahead, Jessica.
Yes, just a moment. Item number 6, receive an update from County Commissioner Ileana Holguin regarding the Bail Bond Board, Border Trade Advisory Committee, and the MPO.
Thank you.
Thank you. I typed up my report because I didn't want to forget anything, so let me just pull it up. Okay. So I'm going to start with the Bail Bond Board. So the El Paso County Bail Bond Board is responsible for licensing and regulating bail bondsmen in El Paso County. The board deposits fees collected Under Chapter 1704 of the Texas Occupations Board, supervises and regulates each phase of the bonding business, adopts and posts rules, conducts hearings and investigations, and makes determinations related to the issuance, denial, renewal, suspension, or revocation of licenses. The Bail Bond Board is comprised of various elected officials, including Judge Maria Salas Mendoza, who serves as the presiding officer, Judge Ruben Morales, Judge Daniel Robledo, District Attorney Ivan Rosales, Sheriff Richard Wiles, Justice of the Peace Ruben Lujan, County Clerk Delia Briones, District Clerk Norma Favela Barcelou, as well as our County Auditor Edward Dion, Mr. Sonny de la Chica as the Bail Bondsman Representative, and Mr. Luis Yanez as the Criminal Defense Attorney Representative. For the first quarter of calendar year 2021, the Bail Bond Board was given the following reports and took the following actions. So e-bonds posted in calendar year 2020, so this is the summary for all of 2020, e-bonds totaled a little bit over $51 million, with close to $37 million in e-bonds posted at the downtown jail, close to $13 million in e-bonds posted at the jail annex, and a little bit over $1 million in e-bonds posted at the satellite office. And those are the figures for 2020. Through the end of February 2021, so far, a total of a little bit over 8 million in e-bonds have been posted, with almost 7 million of those being posted at the downtown jail, about 1.5 million being posted at the annex, and a little less than 100,000 at the satellite office. Additionally, 3-year license renewals have been approved for the following companies: Borderland Bail Bonds, One Call Bail Bonds, and EZ3 Bail Bonds. A 2-year license renewal application was approved for 915 Bail Bonds, and an initial application was approved for a Quick 5 Bail Bonds. Several initial and renewal applications remain pending due to criminal background checks that are still being conducted by the Sheriff's Department. The board meets every last Tuesday of the month, and the next meeting is scheduled for Tuesday, May 25th. So that's the Bail Bond Board. I'm going to go ahead and move on to the Transportation Policy Board of the MPO. So the Transportation Policy Board of the MPO is comprised of various elected officials and staff from the county and the city of El Paso, state delegation members, and elected officials from the smaller municipalities such as San Elizario, the village of Vinton, Anthony, New Mexico, and Anthony, Texas, the town of Horizon, Sunland Park, and the city of Socorro. The TPB meets on a monthly basis, and the next meeting is scheduled for tomorrow, Friday, May 21st. At the January meeting of the MPO, changes were made to the bylaws regarding the election of officers and the month during which those elections were held. Previously, officers were elected at the July TBP meeting. However, because many municipal elections have been recently moved to coincide with the general election in November instead of being held in May, it was deemed necessary to change the date of the elections as described in the bylaws so that officers would be elected in January, very soon after the November elections, rather than waiting for July, which would be several months after there had potentially been a change in elected officials due to the November elections. It became apparent that this change was necessary after the former mayor of El Paso, DeMargo, was elected chair of the TBP in early August, but then lost his bid for re-election after the November election. So after the change to the bylaws was approved at the January MPO meeting, the TBP elected State Representative Lina Ortega as chair, Horizon City Alderman Walter Miller as vice chair, and Mayor Oscar Leeser, our County Judge Ricardo Samaniego, Tomas Trevino, Trent Doolittle, and Ellen Smythe are all members of the executive committee along with the chair and the vice chair. So during the first 4 months of 2021, the following actions have been taken by the TBP to amend the Destino 2045 Metropolitan Transportation Plan, the amended Destino 2045 Metropolitan Transportation Plan 2019-2023 Transportation Improvement Program, and the Destino 2021-2024 Transportation Improvement Program. So we amended the North Darrington project to add the engineering phase, Category 3 local contribution, and reduce the service transportation program metro mobility funding. We amended the Rojas Drive widening project to add the engineering phase and Category 3 local contribution. We programmed the Paso del Norte Trail McGoffin Shared Use Path 2023 using transportation alternatives set aside and Category 3 local contribution. We programmed the Playa Drain Shared Youth Path 2024 using transportation alternative set aside and Category 3 local contribution. We programmed funds for the purchase of ADA compliant vehicles and operational funding for Project Amistad using FTA 5310 program funds in fiscal year 2021 and 2022. We programmed the Industrial Avenue Grade Separation Project using Federal Railroad Administration Consolidated Rail Infrastructure and Safety Improvement Funds in 2021. We amended the Borderland Expressway project to update the limits and project name in fiscal year 2029. We amended the New Mexico 404 widening project to reduce National Highway Performance Program funds and to add National Highway Freight Program funds in fiscal year 2022. We deprogrammed the Booth Road Widening Operational Improvements Project using Border State Infrastructure Funds in fiscal year 2022. And lastly, we amended the I-10 widening at East Lake to FM 1281 to move from fiscal year 2022 to this fiscal year 2021. In addition to taking action to amend the Destino Metropolitan Transportation Plan and the Destino Transportation Improvement Programs, the TBP also received monthly reports from various agencies, including TxDOT, the Camino Real Regional Mobility Authority, the El Paso Regional Intelligent Transportation System, Cambridge Systematics, and the City of El Paso. I know this was a lot of detailed information, but if anyone has any questions about or wants additional information about one of the specific amendments to the MTP or the TIPs, please let me know and I can certainly forward that information to you. The last board that I'm going to report on is the Border Trade Advisory Committee. So the BTAC for short does not meet every month. The only meeting that has been held so far this year was on March 11th, and the next meeting is scheduled for next Tuesday, May 25th. The committee is chaired by Texas Secretary of State, Ruth Hughes. The March meeting was primarily comprised of receiving an update on the nearly completed Texas-Mexico Border Transportation Master Plan. TxDOT, in collaboration and partnership with BTAC, is working with binational federal, state, regional, and private sector stakeholders to undertake development of the Border Transportation Master Plan, the BTMP for short. So the BTMP is a comprehensive multimodal binational plan that will identify transportation issues, needs, challenges, and opportunities and strategies of moving people and goods across the border regions, and beyond. The BTMP will develop potential transportation investment strategies that support binational, state, regional, and local economic competitiveness. The purpose of the BTMP is to facilitate coordination and collaboration between Texas and Mexico on binational planning, programming, and the implementation of policies, programs, and projects at border crossings, and to support the facilities that the multimodal transportation system that serves the Texas-Mexico border. The goal is for the BTMP to serve as a blueprint for binational policy, program, and project recommendations that meet federal and state requirements by conducting a binational analysis of the existing transportation systems, such as roadway, transit, pedestrian, airport, maritime, rail, and pipelines. Also analyzing current and future transportation needs, and assessing all ports of entry support facilities that facilitate the cross-border movement of people and goods. At our BTAC meeting scheduled for next Tuesday, we will be reviewing and discussing the BTMP brochure, as well as the regional plans, and also the implementation of the BTMP. We will also be having a discussion regarding the COVID-19 impacts to Texas-Mexico cross-border movement of people and goods in 2020. That has certainly impacted us tremendously here in El Paso, so I hope to be able to bring more information and be able to report on those findings during the next BTAC report to the court in a couple months. And that's it for me, Judge.
That's excellent, especially the MPO. That one was a great summary. I'm taking notes. So that's what we did. That's quite a lot that happens in both of those boards. So thank you very much. Any questions from anyone?
I think Commissioner Stout has a question, Judge.
Oh, okay. Commissioner Stout, go ahead.
Yeah, Judge, thanks. Commissioner Olguin, thank you so much for your work on the MPO and for the report. I think it's extremely complex, process-oriented, and very few people can really understand it. And the fact that you've jumped in there and were able to give us such a great report speaks a lot to your level of intelligence there. I mean, man, that was. I mean, that you are doing a great job, and I just think it's so fundamental to, how we live day to day. I think that there's growing recognition that while roads and freeways produce and enable economic activity, they also have had disproportionately negative consequences for certain communities. And in El Paso, we're no exception. And as we especially see in the central area and the precinct I represent, from the Chamizal to Lincoln Park to Durazno, Government Hill, 5 Points West, which is where I live, and down the line, we've talked about a lot of the concerns that we have with the Downtown 10 proposal, for example, to widen the freeway and add frontage roads, and then questions about traffic projections, who really benefits from the proposal. And in my opinion, it's mostly for trucks, but I just want to let everybody know that my office shared some questions with Commissioner Olguin, and she was very kind to make sure that those questions got answered. So thank you, Commissioner, for that. I think it's important to, at this, after your report, to just remind the public that we as a Commissioners Court have requested more information from TxDOT, and specifically for the agency to continue studying at a higher level of detail the two alternatives that they haven't given us much information on, reconstructing the highway in its current form and tunneling the highway from around Copia to around Schuster, and they haven't indicated any interest instead just pursuing detailed study on three variations of basically the same alternative, which is widening the frontage roads. And so I think I'm glad to know that Commissioner Olguin understands that the court has a public interest role in making sure that whatever the community ends up with, not just for this, but all major highway work in the future, that we're not just taking destructive concepts and making it less worse. And so, we should continue to take these opportunities to make it better for the quality of life of neighborhoods, to reduce pollution, noise, vibrations, and just the sheer concrete ugliness of highways throughout the community. I just saw a report from El Paso Matters today that talked about how El Paso is getting warmer, and most of the hot spots are along the I-10 corridor. Imagine that, because of the concrete. And so I just want to thank you so much, Commissioner Olguin, for your advocacy and for your representation of the Commissioners Court on that board.
Thank you, Commissioner Stout.
And actually, I also want to thank you. I mean, it's been a lot of the conversations that you and I have had about this particular topic that's really helped me formulate a lot of the questions that I come back with to these different agencies. So I want to thank you for that as well. I find our conversations really help as I'm thinking about how all of these different things affect our community. So thank you for that as well. And thank you for your kind words.
Thank you both.
Thanks.
That was the idea, which I think is working very well, of having these presentations and knowing what everyone else is doing has been extremely valuable. So we thank Betsy for coordinating that and getting them on our schedule or on our agendas. Thank you, Betsy. Thank you. And back to you, Jessica. I'm sorry, Caesar, I think has a...
And Judge, I just want to mention it's all Ramon, so thank you.
Okay. Okay, Ramon, if you're out there, thank you. Okay, Jessica.
Okay, yes, item number 8, discuss and provide staff policy direction on the American Rescue Plan funding. For this item, we ask for a motion to delete.
Because we're working to coordinate a special meeting for June 3rd, so that we'll have more time and we will have some more updates on some of the guidance that has been issued.
Thank you, Betsy, for that, because I think it would have been premature. You got so much more information to present to us. I think that was a great move. So thank you, Betsy.
Yes, sir.
Need a second?
I'll second.
Commissioner Holguin,
Aye.
Commissioner Leon,
Aye.
Commissioner Stout,
Aye.
Commissioner Robinson,
Aye.
Judge Samaniego.
Aye.
Motion carries. Item
Thank you.
number 10, discuss and take appropriate action regarding the FY 2021 and FY 2022 budget and fiscal overview.
Thank you. Welcome,
Good
Wally.
afternoon. Thank you. Good afternoon, Judge Commissioners. Wally Hargrove, Director of Budget and Fiscal Policy. Today's item is an update of the FY21 preliminary outlook, as well as your first FY22 preliminary budget update. Next slide, please. This afternoon, we'll be reviewing hearing dates, the FY22 revenue estimates from the County Auditor, a preliminary outlook on the revenue, expense, and fund balance for FY21, and we'll conclude with an FY22 preliminary budget update. Next slide, please. Our hearings will start with a joint hearing with your hospital board in the first week of August. That will be followed with the county budget hearings during the week of August 10th through the 13th. On the 12th, we'll meet with outside agencies such as your ESDs and entities such as Project Arriba and Crime Stoppers. If necessary, we would also conduct a second hearing with the hospital district no later than the middle of August for a second hearing if needed. Next slide, please. We have received the first revenue estimates from the county auditor back in February. At that time, preliminary estimates were up $13 million or 4%. You will see I had the latest revenue update anticipated in early June, but I did receive them at 2 a.m. this morning. After a super quick review, the revenue estimates have been revised downward by about $6 million, bringing our total closer to $319 million or 2.2%. I have yet to review the details of this revision, and I'll be meeting with Mr. Dion in the next week or so to discuss my review of his recommendations and comments regarding his estimates for this upcoming year. Because those estimates will be integral in the final adoption of your FY22 budget and our overall goal of aligning expenses with revenues. Areas I believe will have change on are likely in property tax, as we have seen recently, the largest increase in recent history. Of that increase, $1.2 billion were added to the rolls for new construction alone, and that's about a 50% increase over the last several years. As you've seen with your monthly updates, sales tax receipts have also hit new highs, especially in the past couple of months, with last month seeing a 37% increase, most likely attributable to a comparison of a month when we had shelter in place and businesses closed compared to our current state of operations with the opening of businesses with no capacity or dining restrictions. Also, part of that timing and the big bump up in our sales tax is the most recent receipt of our stimulus checks being received and adding to our robust sales. This, when coupled with some of our rather dramatic price increases of various items, is also adding to robust sales tax growth. If you've been to Home Depot or Lowe's lately and you need lumber, hang on to your wallet, it has skyrocketed. But for the year, I'll tell you, favorably for sales tax, we're up 9.5% over last year. Now, we did have 2 down months during the pandemic, but the rest of the months were all upward months. But this is one of the largest annual increases we have seen in recent history as well. The other categories we anticipate some potential future change are in the areas of charges for services by the county. I did note on the estimates received early this morning that the federal prisoner revenue had been adjusted downward from the February estimate. This is resulting from a recent change in our federal population counts in our jails. This also is likely resulting from continued border closures due to the pandemic, coupled with a new presidential administration and priority changes that they've made. The new estimate is based on a population of 500 inmates per day, which is below prior year averages that were running 625 to 650 inmates a day. Fortunately, with the recent rate negotiation results, we're still expecting to maintain a level revenue comparable to last year's in light of the drop in counts. But we will have annual increases with the jail for collective bargaining and operating cost increases, as well as contractual increases that will result in net new costs for the jails going up by almost $3 million. I'll go into greater detail later in this presentation. The last area we had anticipated to see potential inflows were for our ARPA revenue replacement. There's currently not an estimate in the FY22 revenues from our auditor, as these calculations have just been compiled and are currently being reviewed. His team, along with ours and Ms. Keller and a bunch of others, including a big team from our legal staff, are reviewing the 151-page guidance to make sure we are leaving no stone unturned to see what our potential revenue reimbursements will be. Next slide, please. This projection will provide you with results for the past 5 years, as well as a projection for the prior year that just ended and FY21 in the upcoming years. These projections are one of the tools you use and the staff uses for future budget, tax rate, and capital planning. And we'll be reviewing these estimates in both tabular and graphical views, followed by estimated budget utilization reserves. Excuse me. Our historical and projected revenues are shown in the first line on the top, highlighted in green. In the center of the table, you'll see historical and projected expenses, highlighted in red, followed by the fund balance reserve at the bottom of the table, which has mixed green and red highlights. Bottom shading green is good, means positive growth in our reserves, while the red projects a reduction in reserves when expenditures are anticipated to exceed revenues. With that, I bring your attention to the center of the table, fiscal year 20 that just finished. The table still has estimate, but it is now an actual. As you can see, fiscal year 20 again finished in a positive position, mostly attributable to two factors, favorable factors on revenues, both in property and sales tax, in addition to the affirmative action that was taken by the county last year to reduce our budget spending mid-year in preparation for the impacts of the pandemic. As can be seen in the next column to the right, labeled fiscal year 21, my preliminary projections indicate the county will likely consume approximately $7 million of our reserves. This estimate is mainly based in the allocation of our budgeted emergency reserve for the new Faster Economic Business Assistance Program to aid our business community. We'd allocated and we'll spend $10 million on that. But based on the most recent anticipated revenues and expenses, I think we'll come in somewhere in the area of $88 million for fiscal year 21, and going forward for fiscal year 22, I approximate about an $83 million reserve based on preliminary anticipated revenues and expenses. Next slide, please.
Wally, real quick, before you move off that slide, your estimated expenses do not include certain things, such as if the county were to pick up a greater percentage of the healthcare, correct?
I've factored a portion of that into account. The question is where the final number ends up. I've got about a 27% rate increase for healthcare, which is not as high as the 37% being recommended by your risk pool board. So I am taking that into account with gross of expenses. The reason you don't see it jumping quite as much in FY22 is FY21 has a one-time $10 million expense from our reserves. So when you back that out, you'll see about a $19 million difference in anticipated expenses for next year. So
okay, but the slides that HR presented where it showed different options where the county picked up a greater percentage.
Yeah, the greater percentage is not factored. Thank you. Next slide. So this slide is merely a linear representation of the amounts from the prior table as you view it from left to right. And the top plum colored line represents the county's general fund revenues, while the blue line below represents our prior actual and future projected expenses. The black line at the bottom being our historical actual and future projected fund balance reserves. I bring your attention again to FY21 when the revenue and expense lines are projected to intersect, which is likely to have a direct effect on our future reserve levels. Of course, under our strategic plan, our goal is to align future projected revenues and expenses and to manage our reserves to prevent significant unplanned erosion. This will also provide the county with the ability to withstand any future economic downturns, as we did this year and we have in the past. Next slide, please. So this is sort of like a recap of your budget register that we use in our budget hearings. As you look at the left column, we just finished FY20 with $95 million. That becomes the beginning balance for fiscal year 21, taking anticipated revenues and expenses into consideration. You can see at the bottom of the column, we could finish this year with approximately $88 million in reserves. As you move to the right column, you begin FY22 with the same $88 million, and taking into account anticipated revenues and expenses, we could finish fiscal year 22 in the $83 million range, pending any further action from the court. Next slide, please. So preliminary FY22 expense outlook. They're provided here in a summary fashion. The total here focuses on material changes of $50,000, which is consistent with our budget hearing review criteria. I've grouped these by major categories on the left. Categories are on the left, with the amounts in the center column and their impact on our overall general fund spend rate on the right. As you will recall from prior slides, our annual spend rate for fiscal year 21 is estimated at approximately $322 million. Contractual increases, leases, professional services, travel, training, and operational expenses at the top of your table are expected to increase by about $5.6 million, or 1.7%, followed by your collective bargaining annual impact and the net impact for our personnel position pay review, which at this point in time would be planned for JPD for fiscal year 2022. Those total $3.1 million. As you look at the table, don't be shocked and fall over. It's not 31 million. I left a decimal out of there at this time in the afternoon. I wanted to make sure everyone was awake and alert. So hopefully that worked. But it should be $3.1 million, about 1% of a spend. Benefits for retirement rate and the risk pool increase, both of which you heard presentations on today, are the basis for the preliminary estimates for increases. You'll see in the next line, about $3.6 million, just over 1%. Also included in the preliminary amount of $1.5 million, or 0.5%, for the necessary excess sales tax transfers out to our debt service that are required by statute. For those of you, if you're not familiar with truth in taxation, that is a requirement for any excess sales taxes we collect above and beyond what we use in the calculated no new taxes tax rate. Next line is our operational contingencies, which includes items such as trial cost, the big portion of that being for the August 3rd trial that is anticipated to start sometime in the summer or early part of the fall next year. Potential contract increases, funding for capital construction studies in preparation and planning for our possible FY23 bond issuance, additional costs for redistricting, and increases for utility and commodities, in total about $3.2 million, or 1%. And lastly, the last component on here is funding for your current and ongoing strategic initiatives. They total, about $6.1 million, or almost 2%. This included increases for regional transportation, your economic impact fund, and growing our capital contribution for the anticipated needs for the county. These total approximately $23 million, and we're taken into account with next reserve year's projections as well. Our new valuations, new taxable properties, sales tax growth will help offset a portion of this growth, and possibly some of our yet to be determined ARPA revenue reimbursements. But we could likely need to rely on a portion of the reserves to bring everything into balance for fiscal year 2022. Next slide, please. I have conducted a high-level preliminary review with Ms. Keller. I'm recommending that the court consider the areas of funding necessary to cover our base personnel and benefits cost, as well as the impacts to our contractual professional services and necessary operating costs, including enhancements to our capital needs and our information technology department and its lease program to maintain our hardware and our system to keep them operational. As we come out of the pandemic, this funding will be necessary to allow our offices to effectively return to a full level of services as our return to operations is implemented in the next few months and in full during FY22. Lastly, as you go into your next round of strategic planning and you consider any new strategic initiatives, we're committed to working closely with the court and administration as we cost out the implementation of and identify any potential funding sources for your plan over the next 5 years. Here in the very near future, I'll also be working real closely with Mr. Dion and his team on the revenue impacts that are anticipated for next year. I'm glad to say he also gave me revenue estimates for the upcoming 4 years as well. We'll be running some interim tax rate scenarios and the impacts that those tax rate scenarios could have to our FY22 revenues. It's important to note as we run these estimated tax rate scenarios, it's early in the year from a valuation perspective. So this will be an approximation only and could be subject to change based on a high volume of values being contested this year with the CAD and the receipt of our final values from the Central Appraisal District on July 25th. Judge, Commissioners, Ms. Keller, I thank you. I thank my dedicated budget team and the county department heads and employees who worked diligently on their budget submissions this year, and in particular with the challenge that they faced and lived through for the past 15 months. This concludes my budget presentation today, and with that, I'm available for any questions you may have.
Thank you, Wally. Look forward to, I know we're going to have a challenging year, a lot of assumptions based on so many changing situations. So we thank you and your team to keep us moving forward and understanding as we get to the actual budget session. So thank you, Wally.
Certainly.
Thank you. Jessica?
This brings us to items 12 and 13, the addendums to the agenda. Item number 12, discuss El Paso County's potential litigation concerning voting restrictions legislation. County Attorney File Number 010121AA, pursuant to Texas Government Code Section 551.071. We're asking for a motion to delete this item as well as item number 13. If I can read that in, discuss and take appropriate action regarding El Paso County's potential litigation regarding voting restrictions legislation. County Attorney's File Number 010121AA. Could we please have a motion to delete the items?
So moved.
Second.
Commissioner Holguin?
Aye.
Commissioner Leon?
Aye.
Commissioner Stout?
Aye.
Commissioner Robinson?
Aye.
Judge Samaniego?
Aye.
Motion carries. And that completes all the items on our agenda today, Judge.
Well, thank you, Caesar, and your staff, Betsy and everyone, legal, everybody helping us to move forward. I believe this was really very productive, a lot of great information, and I think we achieved your goal, Commissioner Holguin, that more interactive and that it doesn't feel or sound like on Monday. So I think today was much more interactive. So thank you very much. All of you, I wish you the best today and over the weekend, and look forward to some exciting things that we could do to make a difference for our incredible county. Thank you.
Thank you, Judge.
Thank you.
Thank you, sir.
Good night, everyone.
Good night, everyone.
Thank you, Caesar.
This concludes today's meeting at 2:43 p.m.